Ridge Medical Practice, Karen speaking.
Are we talking cancer?
Well, sometimes it can be a sign of cancer.
Yeah.
Before I was a very calm person, and recently, when I go on my social media, I see something, it just gets to me, I just get angry.
Is that you?
Yeah.
Blimey. I'll never look like that.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I know.
There we are. Okie doke.
It's a good job I've got no kids meeting.
Morning, Ebony.
Morning.
I nearly died this morning, Rihanna. I was running, and there was these 3 sheep that I'd managed to get out of the field onto the dirt path. And then I was like, oh, God, fine, just move out of the way, I'll just walk past you. So I ran, and then they charged at me.
Because I thought you were coming after them.
Well, it wasn't, I was just running innocently. I was listening to TLC.
What were you listening to?
The Creep.
Come in. Hi, love. Here you come. Hello. Take a seat, ladies. So, hello, Hardia. My name's Debbie. I'm a nurse practitioner. What can I do for you?
My leg hurts on my kneecap over here.
Right.
It all started since last evening.
Right.
She can't bend it properly or straighten it up.
OK. And then when she woke up this morning, she came downstairs still?
Yeah, but
Right.
but she can't straighten it up.
No, I can see
Yeah.
she's limping,
yeah,
isn't she?
Yeah.
That's quite
Do
an
it properly.
important point, because usually with children, if it's something and nothing, it would have gone by the morning. What did you do yesterday?
I just was playing and I did some work and I don't know how it started.
You point to where it hurts for me. There. OK, now we need to have a look at it, and I'm just going to take your temperature. What year are you in?
Year 2.
That's a big grown-up year, isn't it?
Yeah.
Right, what I want you to do is I want you to take your shoes off and I want you to take your tights off. You're lovely, aren't you? Eh? Take your coat off as well, because it's... Right, come and walk on this floor. Walk over to me. Oh, darling, does it really, really hurt?
It hurts a bit.
Right, can you try and put your foot down? Does that hurt more?
It's just when I'm going to put my legs straight, it starts hurting.
Come in.
Hi, Rashmini.
Hello. Come in.
Oh, yeah.
Come in.
Okay, thank you.
Come in.
Thank you.
Let me help you to the chair.
Okay, thank you.
So
Thank you.
just to your right, another step.
Thank you.
There we go.
Thank you.
Nice to see you again.
Nice to see you, thank you. I think I've got a fissure or a similar kind of problem,
Right.
a hemorrhoid.
Yeah.
But basically, it's been going on and off the last 2 or 3 years,
Right.
and it's really, really uncomfortable.
Sure.
We've tried the gamut of appointments, quite a
Right.
number of things, and it's not shifting.
Yeah.
So I was wondering if we could try something drastic.
What were you thinking?
Could we try an injection, do you think?
Is there any bleeding?
Well, that's a tricky question, being visually
Because you
impaired.
can't see it, can you? No. Have you ever seen a specialist about them?
No, I've had a CT scan and stuff done.
Right, OK. What was that for?
I think just because I was experiencing a lot of bowel problems.
At the moment, when you're pooing,
Yeah.
then, does it really hurt?
Sometimes it does, but certainly afterwards, there's quite a lasting stinging and
Sure.
itchiness, and
Sure. Sure.
it's really awful.
Yeah, no, of course. Now, I know you've been examined recently.
Yeah.
It'd be good if we had another
No, that's
look.
fine. That's absolutely fine.
Is that okay with you?
Yeah, no, absolutely fine.
Okay, all right. Let's pop you on the couch.
Okay.
So, oh, I was going to come get you. I was going to come get you. So,
Okay.
the couch, can you feel
Yep,
it
got
there?
it. Thank you.
That's the foot of the couch.
That's fine. Okay.
Let me just draw this around. Well, while you're there, just let me get some gloves.
Yep.
Oh, wow, you're already on the bed. You're like lightning quick.
Well, no time to waste.
You see, because you've seen so many specialists, you know the exact position,
Oh, well.
your knees up, it's all done, isn't it? You know, some kind of expert patient. So, OK, that's good. On the outside, I can't see any lump. Yeah, there is a little bit of a...
Pustule.
Yeah, oh, well, no, it's just a little bit of bowel.
Yeah.
There's no abscess there or anything like that. Let's get you decent.
That's fine. Thank you.
So it does look like it's a continuing irritation like before. Have you been getting things over the counter?
I've been tried stuff like, Sudocrem.
I don't think Sudocrem's going to cut it.
Something needs to cut it, I tell you. Thank you.
There we go.
Thank you.
Good lad. OK, so why don't we try a kind of general cream
Right.
for the moment? Also, something that's got a little bit of steroid in it, as well as some local anaesthetic.
OK.
And then if it's not helping, what I would be thinking is something targeting specifically the possibility of a fissure.
Right.
Is that all right? So that's the prescription.
Thank you.
There we
Thank you
go.
very much.
Good. Do you want to ask me anything else?
That's it, I think.
No? Lottery numbers? No?
Well, I'm sure if you knew that, you wouldn't be here, would you?
Are you ready? First, I'll start at your feet. No pain there? No. Does that hurt?
If it's hurting...
Just say, darling, I want you to say, because
No, it doesn't.
I'm just going to move your hips. Does that hurt?
No.
This knee is a little bit swollen
Yeah,
here.
it is,
It is
it
a
is.
bit swollen here. Up you get. There's a good girl. Let's put curtains round you and then you can put your tights back on. I know you're not going to like this, Mum, but I would say we are very, very careful with children's joints. So I think she needs to go up to A&E for them to have a look at her.
Oh, right.
Because swelling and pain in a joint when there is no fall, in children, often it's just their body responding to a virus or something like that, but we can't scan, X-ray, examine, but they do that up in A&E.
Yeah.
Is that
thank you.
OK?
Yeah, that
Pop
would
a
be
tights
good, yeah.
on the... You're a mystery, aren't you?
Yeah, I was wondering as well, how could this happen? Because all the time she was in home. I mean, she didn't go outside, even for cycling.
Yeah. Do you like your bike? Do you ride it without stabilisers? Good girl. That's great, isn't it? What colour is it?
Pink.
Right, so all the best, my love. Get to the bottom of it. See you later, ladies. Bye-bye.
Bye.
Hiya.
My blood test love at 5 to 10.
What name, please?
Kelly, K-double-L-Y.
Brought the sunshine out with you.
Certainly did. And you're looking dapper with the
Oh,
sunshine as well.
thank you.
Yeah, it all blends in together, doesn't it, for both of us, love it? Made your day, love it.
Yeah, absolutely.
Hey, another thing, you're sweet as a nut as well.
Thank you.
Come and take a seat, because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before.
Yeah.
Yeah.
Is it sore?
I feel sore, yeah.
So what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and they can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. Right. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
Okay.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. You OK there?
Yeah.
Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
How are you, love?
Right, so looking inside, there is quite a bit of red blood actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh,
but I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
OK.
There we go.
Oh, you're lovely. Thank you very much.
That's all right. So,
Thank you.
my job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
OK?
Yeah.
I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much.
OK,
You've been
you
lovely.
take care.
Thank you.
Thanks for coming in.
Thank
you
you.
for
Thanks
bringing
ever so
your mum in.
much.
We'll get the door. There you go.
Right, thank you.
OK.
It's cancer.
Mum, she didn't say it's cancer. She said it could well be the cause of the pessary. It's been left in 3
Yeah.
months over.
Or it could be cancer.
Yeah, so you've just
know.
got to,
I know, Linda.
you
I
just
know.
got to wait and see.
I've got these 2 students with me today.
Oh, yeah.
OK, fire away, ladies. So how can we help you today?
So I'm just going to lift up. And if the student just has a feeler. So if you just...
Jaundice people, I always thought, how can you tell if someone's jaundiced? And
Yeah.
then someone came in, I thought, right, I can,
That's
I can
jaundice,
see.
exactly, Simpsons.
Yeah.
If you just flick that like that, just gently. Feels like a guitar string.
If you feel mine, I've got 2 good ones there and there.
Oh, yeah.
Yeah, so that's what you're feeling for, essentially.
Good job. OK, well done.
I really enjoyed it, actually. It was satisfying as the first one, yeah.
Cheers to the 2 of you.
I'll drink to that as well. Cheers. Hello.
Morning.
Hello, Mrs. Attar. Come in. Right, come and sit down. Hello. Right, Smee, do you want to come and sit down as well?
OK.
So do you mind if Smee tells me a little bit about why you come in? Thank you for speaking to our students, by the way.
it's fine, yeah.
Great, thanks.
Okay, so this is Miss Actor. She's come in with 2 to 3 week history of hot pain, starting in the elbow. She's tried using some ibuprofen gel, some painkillers, that made no difference. With the pain, it's probably more so on the lateral side.
Yeah.
She's got Sturgeon syndrome, and she was told that sometimes she gets some rheumatism as a side effect. I was thinking that possibly it could be more so rheumatoid.
So, you mentioned rheumatism because she mentioned Sjögren's syndrome. Any other
I think
ideas?
it could be a trapped nerve as well.
Could it also be golfer's elbow?
Yeah.
Tennis elbow.
Tennis elbow,
Yeah,
that's it.
right. OK, so now we're on the right
Yeah.
lines.
Yeah.
OK, because she's got tenderness.
Tennis?
No, I know. So, the other name for tennis elbow is lateral epicondylitis. Yeah. OK. It is so important that students come to GP surgeries on placements to learn what they see here, the interaction between patients and their doctors, the conversations that we have with families can't be taught in classrooms or from textbooks. So seeing that firsthand, there's no substitute for it, really. So what might she be doing on a daily basis that could cause this?
Helping the daughter.
Yeah.
It's all your fault.
Oh, look at that face.
I work in a school and help children with disabilities. I help them a lot. And obviously this one, she needs help as well. So,
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed in the wheelchair and she helped me a lot.
Does she? So now we think you've got a condition called tennis elbow or lateral epicondylitis. Now we've got the diagnosis, we need to come up with what we can do to help. So she's tried ibuprofen gel, she's tried ibuprofen tablets, and they are certainly options.
Steroid injection.
Right, now we're talking, because that will give you probably the quickest relief, really.
I would prefer something quicker, yeah.
Do you want it now?
I don't mind it. If it helps, because it's got to a point where it's just annoying.
Yeah. Right, let me draw it up.
So what do you think? Marks out of 10?
Yeah, come on, Khadija. How did they do? Not me. I'm 10. Go on. What are we going to give Eleanor, first of all?
9.5.
9.5. That's not bad,
Wow,
is it?
that's a good score.
What about Samit?
Same.
9.5. Oh, I think
Yeah,
you
you always got to leave a little bit for the challenge.
Yeah, I like that. That was nice.
Right, sharp scratch. And with tennis elbow, you want to try and cover as much of it as possible. And I would just fan a little bit out. Davey, just press that down for me, so that's we're all done. How was that?
That's all right.
10 out of 10?
Yeah.
What do we reckon, Khadija? Come on. Yeah. Throw me a bone. 10 out of 10.
She's always having a
Hello.
Hello.
Are we all right?
You look very tan. I agree.
Do you think?
Yeah.
I'm still Menorca tan. In the summer holidays, they've made me do this CCG video about the sun safety with children called Slip, Slop, Slap, about putting on sun cream. And there was me, like, really tanned. I'm so not the right person to do this. Really?
That's so funny. Hi, I'm Dr. Tatham.
Hello.
Hello. Right.
Oh, this has been going on for so long now.
Right.
And it's just basically, I started last year in May with a problem in the top half of my back, in between my shoulder blades, when I sort of try and like bend over a tiny little bit and breathe in. It's really sharp pain. So I tried everything. I've been for acupuncture, I've paid for physio, I've paid for sports massages, I've paid for a chiropractor, I've tried naproxen, I've tried tramadol. Nothing was even masking it. It's the neck pain. That is something that I've had ongoing for probably about the last 10 years of my life. It's like a really like hot, like intense, sharp pain down my arm. What I get around here is a hot, stabbing, dull, constant, like aching pain.
Right. What's your main worry about all this?
That it's not going to go away. It's yeah. Go
Draw
on,
me if you
draw,
want,
doctor.
as long as it's accurate. A bit like Brad
Well,
Pitt.
you've got a strange growth coming out the top of your head at the minute, so I can't say that's particularly accurate. It gets me down.
Okay.
It makes me ratty with my kids.
Has this stopped you doing anything in particular?
It stopped me doing like upper body exercises now. I can't do like lateral pull
So you've
downs
changed what you do.
or shoulder raises. I can't do anything.
Yeah.
This is what my back did look like.
Oh, yeah?
3 years ago.
Is that you?
Yeah.
Blimey.
I'll never look like that.
I can tell you that for nothing. I want to have a look at your back.
Yeah.
So I'll just go and get a chaperone, all right?
Yeah, okay.
2 seconds.
Yeah.
Right, then. Right, this is Adi.
Hiya.
So, you just take that top off of
Yeah.
me and we'll have a good look at stuff. Right, can you just point out to me where you're feeling that pain now?
It's just all there.
In there, right. Right, can you twist round to the right? Oh, it's stiff. And twist round to the left. Right, push that wall over for me. Don't actually, I'll end up in trouble, but pretend. Does that seem to aggravate any of your symptoms? It does?
Yeah.
Right, OK. Follow me, so go out to the side with your arms, and if you get any pain anywhere, just tell me where it is.
Here now. All
There.
down there, yeah.
Right. Pop your top on, thank you. OK, so what I think this is it's the muscles between your shoulder blades that aren't quite right. So if you want a proposal from me, it would be that I get you some NHS physio and...
I've done all the muscle building stuff like that before, so I know how to strengthen the muscles in my back.
I know,
So I
but
just
it's
think,
slightly
you know,
different.
I know, but
It's slightly
I don't know.
different.
I just feel like I think I have had physio for this. If you look back on my record, like 10 years ago, there's some. I just feel like I'm just going through the motions with it. I feel like
I understand
Do you know what I
that.
wanted to get today? I wanted you to come and refer me for an MRI scan.
A lot of people do.
Yeah.
And I understand why people want the scan and feel as that's
Yeah.
going to give us the answers. But from
Yeah.
what you've told me today,
Yeah.
I really don't think it's going to further our journey whatsoever.
An MRI scan would show us when something is broken or misaligned in the back. In most cases of back pain, that's not the case, and the pain results from the way we use our back or misuse our back. And so an MRI scan wouldn't demonstrate to us anything having gone wrong, and therefore is often very unhelpful.
I would be amazed if hospital physio sorts this out, because it's been, like I say, it's been
I will
5
tell you
years
now,
in the
6
making.
sessions of hospital physio isn't going to sort this out, OK? But it's going to take some months of you doing
Yeah.
it to really notice the difference.
OK.
I've got a lot of sympathy for patients who come to us with an idea about what treatment that they should have. But as gatekeepers to the NHS, we really do have to keep a handle on what we refer patients for.
What I'm going to do is leave you with an open appointment to come back, and then we can talk about what the next step is, which may be imaging, but we'll talk about that then.
All right.
Right, OK. Can I
go.
keep that for my notice board? Well, that's very good of you, thank you. Nice to meet you.
My hair is so short.
Short?
Yeah.
It's long. My hair's short.
But look, like it's just short.
Hi there, I'm Linda Eves. How can I help?
I've been getting really bad migraine headaches all this side, and I can't like lift my head up.
So is it like a throbbing kind of a headache?
Yeah, like I can't drive my car.
Okay.
I can't get up.
Yeah.
Like my eyes are burning. I feel very, very tired, lazy, moody.
It certainly sounds like a migraine.
Yeah.
Have you had migraines before?
No.
Okay.
No.
When did you last have your eyes checked?
It's been a couple of years ago.
All right.
Yeah. I think I need to book a
Yeah,
X-ray
I was going to
as well.
say. Would you say anything seems to make it worse?
Oh, it's just like general stress. Like I don't know. Like my family's saying to me that you might have bipolar because I'm moody all the time.
Okay.
Like normally I'm a completely different person.
Let's just check your blood pressure if that's all right. Have you ever felt that you might hurt yourself in any way or not?
No.
We have to ask these questions when
Okay.
people talk about their mood. Your blood pressure's fine, okay? It's just, I'd like you to tell me a little bit more about your mood.
I just like feel very, really moody.
Crying a lot?
Yeah, crying a lot. Been like my own world for some reason. Like, you know, like small thing I make a big issues, like in my head.
Yeah.
Before I was a very calm person, and recently, even I'm on the phone to my friends, I've been just like flipping, shouting at them. I just get too scared as well.
Scared?
I don't know. I don't want to go through depression or bipolar and stuff. I just want to be a normal person.
She's scared now, honest. I'm always scared now. Any pain I get, I'm like, I hope it's not sepsis. I hope it doesn't come back.
You nervous?
No, not too bad.
Yeah?
Do they numb me first?
You'll be okay. I'm here to hold your hand and to talk nonsense to you in your ear.
If I hate this.
Okay, so just a sharp scratch.
Oh, you okay? You're being really brave, I know you.
I just can't stand it, honestly. I'm not joking. I just can't. No, my life has gone this way.
How are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Are you? Why?
It's your neck, isn't it?
It'll be all right.
I'm not gonna lie, I'm nervous.
You're nervous.
I'm
Don't be
nervous, I'm
nervous.
scared.
Oh, don't be scared.
Have a seat. I'm Dr. Tatham. So,
There's only 2 ones that I really want removed, and he said you're only going to be able to do 1 though. But the other one is literally on my leg, and I've caught it and it started bleeding.
right,
That's the only reason I wanted that one off.
we'll have a look and we'll see what's what.
Right, okay, so you lay back. Right, okay.
I've been dreading this all day. Oh, we're going to actually ring up this morning and cancel it, but my mum shouted at me, so I didn't.
Don't worry.
She had a right go at me.
Are you okay?
Yeah.
Right, where am I looking?
It's just sort of like on my right bum cheek kind of thing.
And where's the other one?
That's just there. That one catches on my clothes, but it goes up like a little dried up Rice Krispie. So I've started wearing high-waisted pants now so that it doesn't catch on it.
Well, they're fashionable, aren't they? Are they fashionable?
So,
Yes, they are.
Very fashionable.
Right, so...
You are going to numb it though, aren't you? I'm not, I'm not going to feel it.
Yeah. Tap.
That's not your needle.
Oh, we're going to say.
Yeah.
No, you get the small one.
We're not that mean. You okay? Don't worry.
Right, roll over onto your side towards Karen if you don't mind. It's a right awkward place, isn't it? There we are. Okie doke.
You okay there?
Oh!
It will sting. It will sting.
Oh, no, that's hurting. Oh.
OK, so if we take a little look at these questions, OK, how often have you felt down, depressed or hopeless?
All the time, honestly.
Do you ever feel bad about yourself or like you're a failure or you've let your family down?
I feel down about myself, yeah.
How often have you had any trouble concentrating on things like reading the newspaper or watching television?
Yeah, I don't like watching TV.
OK.
It just gives me depression more. When I see things, even like when I go on my social media, I see something, it just gets to me, I just get angry.
This just sort of gives us a baseline score so that as you get help and treatment, whether that's talking therapies with medication, we'll be able to see hopefully some progress over the next few weeks when we look at the same questions again. The best treatment for people who are experiencing low mood is some talking therapies. How do you feel about that?
Can I not get any medication that like lifts my mood up?
Is that what you were hoping for? Is that what you were expecting?
Yeah, I need something that makes me better. I want to feel normal, like other people feel normal.
We could try you on a low dose of medication, but I just want to emphasise the fact that it is good to have talking therapies alongside that. Let's settle this migraine down first.
Okay,
that should sort that out. And then let's start on a low dose of something called sertraline. Is that OK? And then we'll be in touch in a couple of weeks and see how things are going. All right? So try that number or that number for counselling, or you can come in and see this lady. Now, for some people with this medicine, they do feel a little bit worse in the first few days. Hopefully not a lot worse, OK? But it's not a quick fix.
OK, thank you so much. Bye.
Bye-bye.
Bye.
Right. It's a bit sensitive around there. Gonna squeeze my hand?
Oh, she's good.
Told my mum she should have come with me.
Oh no, it's my role. What are you normally doing on a Monday?
But I would have normally been at work.
Right.
Okie doke. So, let's sort this one on your waist, shall we? Perfect. So this will sting.
Well done. Well done.
I don't know how I can moan about this. I've had tattoos. They hurt a lot more.
Right, here you go.
Okay. Can you feel anything?
It's just a little, like, tugging.
Oh, you feel tugging, yeah. Nothing sharp.
Okay. Gone.
There you go, not too bad, eh?
Okay.
Okie doke.
Right, last one.
Last one.
Well done, well done. Well done. It'll ease in a minute, literally seconds.
There you are, worst bit.
It's a good job I've got no kids being it, because I don't know how to get through time.
You do it. Right.
There you go.
Is it done?
Yeah.
That was the least painful.
That's good. Save the best for last.
That one up, right, sweat on.
Have you?
What did you do this weekend?
Went to Aberystwyth.
Where's that?
It's in Wales.
You went to Wales?
Yeah, I went on Friday, came back Saturday. Megan...
Came back Saturday?
Yeah, I went to a uni open day with our Megs on Saturday.
Uni?
Yeah.
In Wales?
Yeah. She looked at Bangor already, and this is the other one.
She looked at what? Bangor?
Bangor.
Bangor? Bangor and Aberystwyth. Am I saying it right?
Aberystwyth.
Aberystwyth.
How can I help?
I've got a leg infection, right leg.
OK.
How long have you had that for? Antibiotics, and it's still not cured.
How have you got this infection, then?
I walked into a road sign.
OK.
Well, not a road sign, a street sign. Everybody else puts them on a wall. Not a great yarmouth in Norfolk. They pull them out about a foot away from towards the edge. Bright sunny day, I moved over to let somebody pass me on this side. Straight into it. Bang.
Have you had any temperatures at all or anything like that? You don't feel unwell in yourself? No. And do you feel your leg is red or hot or anything like that?
It is still warm.
Yeah.
Check this off. I've got monkey toenail actually now.
And where did you knock yourself in the...
Where the scabs are, just go in.
Just pop your leg down for me, please. Ow. And is this what your leg normally looks like?
No.
It looks more red to you?
It's more red to me. It is on the night. It really flared up and it burns.
Well, it doesn't feel warm the way you were saying.
Back there. Yeah. That's normal.
Are you not feeling breathless or anything like that? You're not feeling short of breath or anything?
No.
OK, well, there's a lot of water.
It's fluid, isn't it, on that?
Yeah. So I'm just going to give you some tablets for that.
What tablets?
Yeah.
Yeah, my wife's had them. She's feeling good in the toilet. Cheer up, might never happen.
So I'm not going to start you on any antibiotics, OK? You've had 2 weeks.
2 lots, yeah.
It's going to mess up with your bowels. Yeah. It doesn't look too bad to me there, OK? Keep an eye on it. Try to keep your legs elevated. You're not allergic to anything, are you?
On an ex-wife. Best thing I've ever done. We're still friends, and that's as far as it goes.
That's good, isn't it? So you know what you're doing, yeah?
Yeah.
So I want you to keep an eye on the leg, OK? If you think it's getting worse, you need to come back and I'll have another look.
Right,
See you later.
Right, thank you.
Bye.
Open wide, Henna. Stick your tongue out, say ah. You're never really off duty in the medical profession. Staff ask you questions from the girls in reception, admin, and you're always sort of watching out and about.
If there's somebody in the public who might need your assistance, you will do what you can to help them.
It's a 24-hour job.
There was one time that I was waiting for my luggage in an airport and a lady collapsed. She wasn't breathing. There was a defibrillator nearby. After 3 shocks, she did regain consciousness, which was amazing.
So I think the most exciting out of hours incident we've had was the birth of our son, Henry. You delivering Henry.
Daddy was midwife
Out
at
Henry
home.
came.
I was trekking in Nepal, and one of the ladies in front of me tripped and fell and broke her arm. I managed to get a plank of wood and padded it with newspaper, and we used some scarves to wrap around it, and then she was able to walk back to the road to get to the hospital in time.
I'm here.
She wanted Chris dead.
Give us a shout.
Yeah, if you feel poorly, let us know. There was one time at the gym where a man was talking about a rash in his groin and suddenly just pulled down his pants right there in front of everyone.
Give it another week. If you get worse, see doctor. All right, my darling. Drink plenty.
Hello, hi. What can I do for you?
I found a lump under my arm. I say it's the size of a pea. It doesn't hurt, but it's definitely a sore feeling.
You've not noticed any discharge from there?
No, well, it's not like a spot or anything. I got in the shower, felt the lump. I thought, well, you automatically think about it, you know, cancer, anything like that. So I thought, well, I'll get it checked out by you guys. The only reason I'm really concerned about that is because my dad died of cancer. So whether it's in your genes or if it's, do you know, hereditary, I'm not sure. But I thought I'd get that checked out.
Okay. And what kind of cancer your dad had?
It basically was riddled with it. It was everywhere.
Come in. Good morning.
Good morning,
take
love.
a seat, love. Is it Beryl?
It is, love. Back where, love?
All right, my love.
Right, OK. And you wanted to book another appointment, did you, my love?
Any time, any day, love.
I think you'd benefit from some steroids today. What do you think?
You all right, love?
You're right.
All right, love.
Deep breaths, my love. And out.
Hello.
Hiya, love. You OK?
Yeah.
Yeah.
It's all right, carry on. I feel so sorry for you, love.
It's one of them days, love. Don't worry about it.
All right then, my love.
Thank
See you.
you.
Bye,
Yeah.
Amy.
Come on, Bubba.
See you later.
Ta-ra, love.
In you come, my love. I'm Debbie. So this is baby Dylan. He's 9 weeks old.
Yeah.
And your mum.
Yeah, I am, yeah.
And today Dylan's come for his 8-week baby check. Have you got any more children?
Yeah, I've got 4 at home.
4 more at home?
Yeah.
Wow, so he's your 5th?
Yeah, he's my last.
Your 5th and your last, definitely. Well, we'll talk
Trying
about
for a
that.
girl, but all boys.
Have you got 5 boys?
Yeah.
Fantastic. And there is some very rare syndrome that touches your family a little bit.
Yeah, I've not seen any in
But
him,
you've not seen... Has
No,
any of your
I've
other children got it?
My eldest and the one just before him.
Right,
yeah.
so it's called Waardenburg syndrome. Yeah.
It mostly affects the hearing.
The hearing, yeah, and
but
some
he passed
pigment.
his flying colours,
He's passed his with flying colours. So you know all about that and you're happy with it. Right, my love, so I want you to take all his clothes off, leave his nappy on.
Hello, chunky monkey.
Hello. Hello, darling. I'm your Auntie Debbie. I'm going to turn my light off now and look inside his eyes.
Sometimes he goes a bit boss-eyed. Is that normal?
Babies, you in the first couple of months often go boss-eyed.
Oh, OK.
He's looked fine today. Keep your eye on it for 3 or 4 weeks. If you see it again, we want him to come back.
OK, then, no problems.
Just going to listen to his heart. What are we doing to you? Oh, yeah. Right, so his heart sounds are completely normal. He's breathing beautifully. Just check his testicles.
Yeah.
One there, look. One there. He's got both of them down already. So if you dress him but leave his legs out, and then I'll get his injections ready while you do it.
Hey, you're a nice
So until your oldest child got this syndrome, did you know anything about it, or was it...
my mum's got it, yeah. My mum's fully deaf.
All right.
Yes.
Did she sign or did she lip read?
We all sign in the family.
Yeah.
Her mum's deaf, her dad's deaf.
Right.
I'm partially deaf in
Oh,
this
you
year, yeah.
Pop him on your knee when he's ready, my love.
Coming in you.
No need to rush, though. So, the first thing he's going to have is drops in his mouth, and the drops protect him against a virus called rotavirus.
Yeah.
They taste nice.
Oh, OK, that's good.
Rotavirus is a very nasty diarrhea and vomiting bug. Now, then, you'll like these because they're like sweeties for babies. A big bruiser like you should love these. There you go, aren't you clever?
He won't turn anything that goes in his mouth down.
That's what we like, though. Big strong babies, there's not like them, is there? So if you put your hands around his middle, I'll deal with his legs. It's going to scream like mad.
Yeah,
his legs are going to bleed.
expecting
You're
it.
ready, aren't you? You're a sensible lady. 1, 2. First one done.
I know, baby. Oh, bless him.
All done, darling. There you go. All done. I'll have that in a minute when it's settled. There you go. Get that done. What did the nasty woman do to you? There you go.
Oh, darling. Oh, bless him.
Where do you feel the lump?
There. Just put your finger right there. Feel it.
Because I'm rubbing off my finger on it, isn't it?
Yeah. It's only so it only hurts slightly if you push on it.
Yeah. It's a tiny, small lump, isn't it?
Yeah.
Yeah. Okay. I'm just gonna feel your armpit if you don't mind. Okay. Okay. Can I see the side as well?
Yeah.
Okay, that's fine. And should we? Yeah, you can put on your shirt. About the lump.
Yeah.
So this lump, I know you said you were worried about cancer.
Yeah.
It doesn't look like a type of lump that we would see with cancer. It's something we call folliculitis. What it means is that we do have hair on our body in different regions.
Oh, yeah.
When one of the hair somehow falls and infection gets entry into the root of the hair, that causes a bit of swelling. That's what it is.
Oh, okay.
So it's nothing but the blockage of the hair root.
Yeah.
We don't need to do anything specific to treat it. It gets better at time.
Yeah.
And most of the time, it resolves within a week or 2 week time.
All right.
Just examine it after a week. It probably would have gone.
All right, brilliant. Cheers.
Thanks a lot.
Thank you.
I was talking to an 80-year-old this morning. She says, doctor's asked me to book a telephone call. All right, okay. Tell me which day is best for you. And she goes on, this is what I do this and I do. And I go to the gym on a Tuesday. I went, what?
Well, my granddad's nearly 90 and goes to the gym 6 days a week.
Says I'm 80, and I've been going every week for the last 25 years. I thought,
Oh,
you
my
girl.
gosh.
Yeah. Got to go and join him myself.
Mr. Robinson.
Yes.
Come in. Right then.
Yeah.
How are you?
Well, not so bad apart from my leg. The trouble is, you put up with it during the day, but I do stumble a bit with it. But it's at night in bed that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Should we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes, yeah.
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now and again.
Good lad. Right then. Do you get out and do much walking?
Not a lot.
Do you get out the house at all much?
Yeah.
Yeah?
Yeah.
You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just downside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outside of your thighs here,
yeah,
isn't it?
yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this.
Yeah.
So I think best thing is to try and keep as active as you can. So a little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself
yeah,
and just... What we don't want is for you to fall over, do we?
No.
Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
So I've 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right? Bye-bye.
Thank you very much.
Right, lovely to see you. And thanks for sharing that with us as well.
See you later.
Sorry about it.
Not at all, not at all. Nice to see you again. I hope I don't see you, obviously, for a long time, but
yeah,
well,
so do I.
all right then.
Bye-bye. There you are, hold your jumper. Bye-bye. He's lovely.
See you later.
See ya. Have a nice time.
Good morning, the Ridge Medical Practice. Vicky speaking.
I got bitten by a dog yesterday.
OK, right.
And he drew blood.
Where is it most sore?
It's hurting in here.
You're such a brave boy.
I lost my husband in end of May. He went in and he didn't come out.
Must have been a shock.
Traumatic. Yeah, it is a shock.
Have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, all right.
If I show you pictures of poo on my phone, if that's OK.
How are you feeling about what happened?
I'm paranoid. Really paranoid.
Yeah.
Morning, Ebony.
Morning.
Leonie. Oh my God.
I'm Susan Towers, a GP, but with an interest in skin problems, so that's why your doctor sent you here.
I hope you can help me.
So you didn't have any problems with your skin as a child?
On and off.
What did you have?
Patches of eczema, but then more recent, I've had outbreaks like all down my back, all down my legs, and the biggest problem is my ear. I've had that ongoing for over 12 months now, antibiotics, cream, steroids, anything, and it's just not helping.
Is there any reason why you can think that might have happened? Your job, for example, or any hobbies?
I'd say maybe stress-related. I think age thing, getting older.
You perhaps stress more because you know there's more to worry about, don't you, maybe?
Yes. I've had poor mental health, so I've just been getting myself more well.
Right.
So focusing on my mental health, going to support groups and stuff.
OK.
I've been using hydrocortisone ointment on my ear. It itches, so in the night I'm waking up and my ear's on fire, so that's what's been bothering me more lately. This is really bad.
Oh, that's nasty, isn't it? Do you colour your hair?
I have dyed it, but I haven't had hair dye in the ear.
It is leaching out slowly over time, that's why it
Right.
fades, and so it can irritate you if you're sensitive. Can I look at, what did you say, your legs are bad?
What they are on my legs is more scars.
Let me pull this round.
Yeah. These are the recent ones that I've just scarred.
Okay.
I say they're like cigarette burns.
Yeah, you do have a spotty type of eczema, which some people have.
And these are my old
marks from
scars.
previous, yeah.
But this is why it's bothers me, because it's come back again. No, it's scarring me. I'm not sure if you can see if there's any on my back still, but normally I get them all over my back.
Oh, there is. Okie doke, thank you.
Come and take a seat. So this is a new chap, is it?
Yeah, we're engaged now.
OK, so you missed your appointment yesterday for your B12, is that right?
We got it wrong place, didn't we? We slipped up, didn't we?
Anyway, let's see when your last one was.
You won't know anything about diabetic, will you? Do you?
Want to know, yes?
Oh, well, we've come to the right place.
Yeah. Well, I did my blood this morning and I was 17.7.
OK. What is it normally?
One day last week, it came up to 22.
Anything changed in your diet?
No.
You're not having more cakes, biscuits, chocolate, anything?
No, I've been
eating a few sweets, but...
I've been eating a few, but not a lot.
No.
It's telling tales on you.
I know. Because we go shopping and, oh, a bag of sweets goes in straight away.
I wonder who's putting the sweets in that...
Me.
OK. So just be careful with those.
Yeah, well...
Yeah.
Right.
OK, love, yeah.
Shall we do your B12?
Right.
Where do you normally have it?
Either my left or my right.
Do you think this injection now might bring a blood test down a bit?
This is not going to have anything to do with
ain't it?
glucose levels, no.
No.
So
Right.
this is like iron deficiency.
Yeah. I
So
see.
she might get a bit more energy.
Yeah.
I could do
She's
with
full
some.
of energy.
Is she?
We go cycling.
Good.
I went cycling yesterday and I fell off on my bike. Look.
Oh, keep an eye on that.
It's all right.
Does it need
It
out
looks
on
okay.
We're
but
putting
if it-
Savlin on, aren't we?
If it gets more red, more hot, and any swollen, come back and get it checked. But
Yeah.
keep it clean.
Right.
Right, shall we do it in your right arm?
Right.
OK.
There goes, there goes.
So relax your arm down, OK? You know it stings a little bit, don't you, when it
Yeah,
goes in?
it does, yeah.
Look at you, fella. Can't scratch. It's all right, nearly done. All done. Okie doke.
Thank
All
you
done
very
for
much.
today. You're welcome. Nice to meet you.
Yeah, nice to meet
Yeah,
you.
and you.
Oh, yeah. She's not just a pretty woman, eh, love?
We'll see you again, love.
See you
Right,
later.
bye, love.
Bye.
Your skin surface is supposed to be like a brick wall, with
Yeah.
the bricks are your skin cells and then the cement in between them. And people with eczema tend to not have quite as good cement as people who don't have eczema.
OK.
That means the bricks fall off more easily, so your skin tends to be a bit drier and flakier.
Yeah.
You lose water through the gaps, but also things can get in. When something gets through those little cracks and irritates, it irritates you a lot more than it would irritate somebody without eczema.
Yeah.
And that's why steroids are needed, OK? Because they suppress the inflammation. But we don't want to keep using steroids because they're going to damage your skin. Yeah. That's why we've got to prevent with lots of moisturiser.
Is it common that? Because people think I've got flea bites and stuff. I've never seen it before.
Well, I've seen it like that. Some people do have a spotty type of eczema.
And why have I only just started getting it?
Stress always makes things worse. We know it affects your immune system.
Right.
Maybe when you weren't so well with your mental health, you didn't look after your skin as well as you do now. I don't know. It's a combination of things usually. But anyway, now you've got to start.
Yeah,
again.
Definitely. Better than you fobbing me off, really, because I was thinking it just weren't curable.
It's not curable, it's controllable.
Yeah. Lovely.
So you've got 2 tubs of moisturising cream, so that'll last you 2 weeks. I've given you this quite strong cream called Cinelar C. I've given you loads more than I think you'll need, actually. It should be loads better within a couple of weeks.
There's hope, isn't there?
There's definitely hope. You're going to get better.
Yeah,
promise.
thank you very much. Thank
You're welcome.
you.
We have a big problem with his willy with foreskin. Last couple of days he was complaining that it hurts.
Yeah.
And that he feels the pain when he doing wee. And yesterday at school he fell over and he squashed it somewhere. I've been asking him if it was hurting before he fell over.
Yeah.
He said yes, yes.
Yes, OK. Right, let me have a little look at you. Well done.
He come to me yesterday and tell me, Daddy, I have a little problem.
Oh.
Pull his pants down, look, he's swollen and bigger and getting bigger and bigger.
Poor thing. OK, so it's slightly up now. Right, over here onto this little
Chodź,
thing
pani
here,
sikorka
right,
obejrzy
sweetheart?
rybcia.
Over you come. There's a good boy. All right, then.
Oh, that side is worst.
Is it uncomfortable?
It is hurting.
It's hurting. Yeah, normal.
I think he squeezed somewhere here, or is it infection or something?
It does look a little bit infected, doesn't it?
Yeah.
I agree. I'd like just pop his things back up for a moment. I'm going to ask Dr. Keris to take a little look at him because that's sort of, well, it's obviously tender, isn't it? All right, I won't be a moment.
Okay.
But it looks like bruised at the base of his penis, like really bruised.
Really?
Like, because they said it was really swollen up.
Okay.
And I thought that doesn't look normal.
Right.
So.
Okay, sure.
I don't know if I've been bitten on my eye by something. It's just literally swollen my whole eye up.
And 2 evenings ago, I sat out on 10:15 when it just getting dark. I got bitten by insects.
We're in garden. Chris stood on a wasp's nest. His whole body's covered in wasp stings.
Whatever it was flew on, bit me there, and carried on its way.
Well, I came in last night because I'd been bitten. It happens this time every year.
Oh no! I keep getting bitten by something everywhere, look. I've had one there and one there, but I don't know what it is. It's proper doing my head in.
Right.
I got bitten by a dog yesterday.
OK, right.
And he drew blood. And the police suggested that I come to see the doctor.
OK, so tell me what happened.
I'm walking down the road and there was this woman standing by the car, husband standing there and her son with a dog on the lead, a little rat on the lead, yeah?
OK, yeah.
Suddenly it jumped up and bit me through the leg.
Right.
But I was more shocked.
Yeah, of course.
I mean, I love dogs. I've had dogs all my life, but I've never, ever been bitten by one.
The vast majority of dogs are beautiful, nice animals, you know. Right, shall we have a look at it?
Yeah. Don't think I can get it out far enough.
It's all these new trendy pants that are all tight at the bottom.
Yeah, look. Oh, I might.
Right.
It actually hurts.
Yeah, I bet it does, because it's bled underneath as well, which is that bruising that you can see there.
That really hurts.
Right, there's a couple of things we need to do. Because he's broken the skin, we need to give you antibiotics.
Yeah.
Any bite that breaks the skin, we give antibiotics for.
Yeah.
We need to give you a tetanus booster as well.
I haven't had one of them for a long time.
Yeah,
Okay.
I need the top of your arm for that, so if you can just...
Take me jump.
Yeah. Are you allergic to anything?
Not that I know of.
So this will protect you against tetanus for the next 10 years. So
OK, thank you.
Right, just a sharp scratch, sorry. We're all done. That's
Thank you very much.
No problem. And a course of antibiotics to take for 7 days. It's certainly not infected or anything now.
That's good.
It's just about protecting it from getting infected and protecting you from tetanus. 1 4 times a day for a week. That's you sorted.
Thank you very much.
All right, nice to see you.
And you. Thank you very much.
See you later.
Bye.
OK, I've got Dr Caris in to take a look at Philip as well, all right.
Right, so what's happened then today?
He got that problem with the foreskin.
Right, tell us a bit about it. What happened at school then?
I was running, then I fell down.
You fell down? Yeah. OK. Oh, did you land on someone's leg or someone's knee? Maybe. Yeah. We've got to make you feel a bit better, haven't we? Yeah, what do you reckon? Should we have a little look at you? Are you able to sit down? Right. Can you pull the skin back yourself? Is it going to go back? Show us what you can do. OK. Right, there's some bruising. Right, yeah, a little bit. OK. What year are you in at school then? What class are you in?
Year 1.
Year 1. So how many teachers have you got?
2.
2. Right, can I have a little look down here, see if we can make it feel a bit better? Yeah. You're a good lad, aren't you? Where is it most sore? It's just all over, isn't it?
It's hurting in here.
It's a bit swollen, isn't it? OK, you're such a brave boy. OK, did anybody kick you today?
Yeah.
Who kicked you? It's OK, you can tell us what really happened. It's absolutely fine.
Someone kicked me and then I fell over.
OK, where did they kick you? In this bit?
Yeah.
Pull your things up, OK. I think you're the bravest Year 1 boy I've seen today, definitely. Definitely. Right. I think probably he's been kicked there and that's flared things up a little bit and it's all a bit swollen and that's aggravated the problem. He has got a tight foreskin and he may well benefit from a circumcision at some point, you know, where they remove the foreskin to allow it a bit easier.
I'll do a referral and then they can discuss it with you about whether to do it straight away, to wait and see.
You've been ace. Yeah, such a brave boy. Because he's able to pee, we think we probably need to give him some antibiotics to try and help settle that down. You may be more comfortable sitting in the bath and trying to pee in the bath, you know, things like that. Okay. Is that all right?
Thanks for your
all
help,
right, I'll leave you in very capable hands.
OK, thank you.
Any questions?
No, I think we know everything.
Yeah, there we go then.
All right, thank you.
You're welcome.
Bye-bye.
Bye-bye.
All right, see you, bye.
OK then. Bye.
There medical practice, Dawn speaking. I'm afraid our system has crashed at the moment. We're not able to do anything. I think it would be the same at our other surgeries as well, yes, because we all use the same system. We are advising people if they could call back in about an hour or so. No, I'm afraid I can't do anything because none of the doctors can get onto the system either. I can't physically get onto the computer to see the appointment system. I would advise you ring 111. As I said to you, before the systems went down, I knew that all the appointments for this afternoon had been fully booked. I'm really sorry, but there's nothing I can do because there's no system. The only option would be to ring us in the morning to try and get an appointment then.
Dorina. Hiya. Come on down.
A bit faster. You know, I feel a bit...
You're still walking quickly enough, though, aren't you? Hey?
Do you not die if I can't?
Yeah? What's been the matter?
My feet.
Yeah?
Here. When I put in the morning, put me here.
Yeah.
I feel like a sponge.
So is it tender?
Oh, yes. Even the painkiller doesn't kill it.
If I press there, is that where it's tender? Yeah. It probably is fasciitis where...
Yes.
It's where the arch drops a little bit.
Yes, but it's the other foot as well, just the same.
Yeah, it's often the same on both feet. Yeah. What commonly happens is if we look at your foot sideways on...
Yeah.
That's your heel bone.
Yeah.
And those are the bones going to your toes. You'll have this strong...
yes, there.
This strong tendon that goes along to form the arch of your foot. And what that tendon does, sometimes it flattens out and it pulls on the bone here, and it causes an inflammation of the tendon and around that heel bone. That's the thing that's painful. Yeah. What you can do is buy some supports that support the arch.
Oh, my son's bought me two.
And the other thing you can do is you can give an injection to that area.
Oh, no, then I'll try with that.
Do you want to try with that for another few weeks?
See how thing goes.
OK. So you were telling me last time about, because when we're going down to see my son.
Yes, he's still down there, isn't
In Sevenoaks.
Sevenoaks.
Yeah.
He used to be beautiful, but he wasn't very populated. I remember it was there, but it was beautiful, clean, part of the countryside.
And why were you down there again?
Because I had relation everywhere.
So you were a guest of Mary Soames, who was Winston Churchill's daughter.
First daughter.
And you used to go and stay?
Yes, because Auntie, she was the top chef for them.
What year was this? Was it?
In 1954.
Yeah.
Because Winston used to say, "Oh, Bradford is very dark."
So we'll wait and see how you go with the padding.
Yes.
Another 3 or 4 weeks.
3 or 4 weeks.
Still struggling. We'll reconsider possible injection.
Well, I'll try anything.
Yeah? OK.
Thank you very much for everything. And you look after yourself.
And we'll see you again if you're struggling still with this.
I'm getting old. But no, not.
You're still great. Yeah.
Keep on going.
See you later, dear. Bye-bye.
Did you see me at when I was 14? And I thought I looked like a right stunner. I went to my sister's anniversary and she had the album out. That's why I thought to myself, oh, you looked pretty not bad.
Even though you say it yourself?
Even though I say it myself.
That tall, weren't you?
I know, I was actually tall.
Oh, it still looks like you. You haven't changed a bit.
That's me, yeah. And then look at this.
Yeah, you still, I'm sorry, but you still look good. You were, what, 14 there?
Yeah.
Yeah, you should have seen me up when I was 14.
No, I can't imagine you being chubby at all.
Come on in, have a couple of seats. I'm Dr. Caris. Right, this is Angela, is it? Who have you got with you?
I'm an auntie.
Auntie Linda.
Yeah, they live with me and my husband.
All right.
Mum died. So.
All right, OK. Right, what's going on?
I'm struggling to breathe again.
All right, OK. When did...
She's been on for nearly 5 weeks now.
5 weeks, all right. Because
she's got inhalers and she's using them, but they're not touching her.
Oh, really? Right. OK, so which inhalers have you got and which ones do you use?
I use that one at night and morning. And that one during the day when I need.
OK. Let's check you out then. Have you had your inhalers today?
Yeah.
And have you ever had trouble with your breathing before?
Yeah, but not as bad as this.
Not as bad as this. OK, right. Right, let's pop this on one of your fingers, eh? And how do you feel in yourself now?
Just a bit breathless.
A bit breathless, yeah. Because your oxygen level's very good, 99, and your pulse rate is OK. Can we have a quick listen? Is that all right? Able to stand up, eh? I'm just going to have a little tap first, OK? Feel a bit warm, don't you? OK. Just have a wee listen down here, don't mind if I just... OK, that's fine. Have a seat. So, I mean, listening to your breathing, it's very clear. There's no sign of any tightening or asthma there. Your numbers are very good, and clearly you're struggling a little bit. And I just wonder if that's more sort of an anxiety, panic attack type of thing rather than a flare-up of the asthma. Our brains control our body, as you know, but sometimes they can sort of go into override, if you like. And certain things, sometimes for unknown reasons, can start making us feel a bit edgy and a bit anxious. And I think that's probably what's going on. Has anything happened today at school, or that's maybe could have made you feel a bit anxious and things? No. Yeah, panic attacks, they are very common. Much more common in ladies for some reason. Much more common in sort of your sort of age group, if you like, and it maybe is because there's a lot of changes going on, but also there's a lot of sort of emotional stuff going on, and difficult to manage sometimes. There's a phone number we can give you that you can ring and you can get access to someone who can talk a bit about it. Would you like to do that? I think that's probably the best option, isn't it? All right, any questions from either of you?
Thank you.
All right. OK, we'll get you sorted, no worries. All right. See you later.
Come in. Hi, Mr. Arnott. Come in, I'm Dr. Khan. Come and sit down.
Nice to meet you.
How can I help?
So, Saturday, I went for a drink, went down to Tesco's, went to go buy some more beer. As I was down there, a group of lads ended up chasing me.
Right.
I must have done a good 5-6 miles of proper sprinting, running for my life kind of thing. I've really damaged both my calves, like to the point where I woke up this morning, I couldn't get out of bed.
OK, so now tell me about the leg.
I struggle standing up, walking around.
Yeah.
It's just, it feels like constant cramp.
OK, both legs or just one?
Both.
Right, and whereabouts?
Like, all my calf.
All along there?
Yeah.
And you ran for how long do you think you ran for?
A good 5-6 mile hour running for a good couple of hours.
And for a couple of hours?
Yeah.
Right. We'll have a look at your legs and sort that out. How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah.
Oh, thanks, Vicky. Just what it was.
Where would you like me to leave it?
Could you leave it just there? It's going to look at me all morning and remind me of apple juice and remind me to drink.
You've not suddenly started passing stools into your pants?
No.
Is there any blood in your poo?
No.
Heidi's been having quite sort of mucusy poo.
And is it like watery or soft?
It's watery. It smells horrible.
Is like a child's poo supposed to be black?
Going to the toilet OK?
Going to the toilet a lot.
Not been any blood in your poo?
Are they hard, soft, normal?
Carry a bag full of poo.
Her poos are just not formed.
Hiya. Guess I got you.
Moppy.
Go in there. Come in. Hi, honey. Please take a seat. So my name's Dr. Eunice. I'm one of the GPs working here. This is Angelia and your mum?
My name is Amber.
Yeah, hi, Amber. How can I help?
She hasn't been very well. I think she complains a lot about stomachache all the time.
Where in the tummy are you having the pain?
In the middle.
And do you have the pain at the moment? No. OK. When was the last time you had the pain?
About 3 hours ago.
OK. When you go into the toilet, when you're doing a poo, I'm going to ask you some silly questions about poo now. Is that OK? When you're going to try and do a poo, is it hard to get the poo out? Do you have to strain a lot to get the poo out? OK. If I show you pictures of poo on my phone, if that's OK, would you be able to tell me which ones you have? I know it's silly, I'll just... What sort of poo do you get when you do a poo?
That one and that one.
OK, so when it's this one tells us that you're a bit constipated, OK. Have you noticed any blood or anything when you wipe? Nothing on your tissue, nothing like that? No. OK. What's her diet like?
She eats fine.
What sort of food would she eat?
Mainly containing bread.
OK.
She likes paninis.
What about vegetables, fibre type thing? You're already saying no very much. No, OK. Because I think that's part of the reason. So normally when kids are constipated, usually diet has a big control. So we need to make sure we drink plenty of fluids, but also plenty of fibre, so vegetables and things. Can we have a feel of your tummy? Would that be OK? Perfect. So if you pop up on there, and if you lie back down for me, honey, is that OK? So all we're going to do is feel your tummy. Is that it? That's all we're going to do. No pain at the moment? No pain down there? Bit of pain there, OK. That's fine. If you pop back down there. I think we're going to give you something to help with opening your bowels. So this tummy pain might not be, but it's likely that it's all related to this constipation that you suffer from. What we give you to help with that, we give you some medicine. But actually, the main treatment for it is going to be looking at her diet, make sure you're having the good type of food. I know they don't taste nice. You know, I was horrible when I was a kid with vegetables, but like now I know the importance of it.
Thank you so much.
That's fine, thank you. Thank you. See you later.
Thank you.
OK, thank you. See you later.
Still got 2.5 hours left.
Who was?
Me.
2.5?
Yeah, but well, you know what I mean.
2 hours and 20 minutes. Every minute counts. So it's 10 minutes knocked off of it.
Once you're in the hour, it's a breeze.
Oh, yeah, no, tell me about it. We've got a temporary registration patient coming, hopefully soon.
feel like if I press these, I'll shoot out of this chair.
Are you nervous about going out or anything like that? Have you been out since then?
No, I was going to get bus time. I couldn't even get bus time. I ended up getting a taxi and...
Yeah, it's a very stressful situation to have been in. I think everyone would feel nervous about going out after something like that.
Talking about traumatic experiences is really helpful. Mental health and well-being is so important, especially in young men. It's just as important as your physical health. Evidence suggests that young men are most at risk of suicide. So if you are feeling troubled, down, anxious, please come and see your doctor. We're here to help.
So your legs and the difficulty with your legs, that's easy for me to take care of. It's how we manage the kind of the impact of being chased by these people.
It's paranoia, like there was someone who knocked at my door today and I wouldn't even go open the door.
Right, right.
Just because 2 months ago I ended up getting robbed at knife point.
Oh, God. Have you had any support kind of through these incidents that have happened to you?
I've done like therapy before. I've been on like all the antidepressants and stuff like that, which in my opinion I don't think they do anything, but...
They don't work for everyone, you're right. And if you've been through an awful situation or you're going through an awful situation, they can never take that away from you. I think there's more going on under the surface. We do have a fantastic counsellor here at the surgery, and she does talk to you back as well as listen. The first few appointments are about listening and getting to know you, but then after that, it's about talking about how to cope with things and how to manage things better. So why don't we arrange to see each other in a couple of weeks after today and make sure that side of things is settling, and if not, we can think about how we manage that.
Yeah.
Let's have a look at your legs. That's what you're really here for, isn't it? Okay. So...
Give me a second.
No, take your time. Right, so if you just lie down on there for us. And I'm just going to have a feel of your legs. Is that sore?
Yeah.
Yeah, they are very tight, aren't they, your legs? OK. What's happened to these muscles, really? It's just because they're not used to that distance of running, as most muscles aren't. They've become swollen and tender as a result. We need to give you something to reduce all this inflammation down. OK, I'll sort that out. Just come out when you're ready, Simon. I think there's a lot of positive things about you, Simon. I was just thinking about it. You're a young lad. You've been through a lot, you know. It's difficult things to talk about, but, you know, you've talked about them, and I think that's really important.
Yeah, it's hard to speak to my mum about stuff like that, and because she'll worry more than me. And
does she get worried as well?
Yeah.
As mums do, eh?
Yeah, and I don't want my mum getting more worried than I am.
Yeah, I think that's fair.
There's no point putting pressure on her, is there?
You're a nice lad, Simon. Oh, don't forget this. This is the key to your legs getting better.
Thank
All
you.
right, see you in a bit. Bye.
Wonderful, thank you.
I can keep hearing, like, you know, beep noises.
Not sure I can see anything.
It's there.
Right on the...
There, so it's there.
Sometimes in the middle of the night, it's like drum beats. I can hear this dum, 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 and then it stops.
Right, I'm Dr. Caris, and we've got Karen knocking around.
Yep.
So...
Sorry, what's your name?
Dr. Caris.
Carey.
Caris.
Kelly.
Caris.
Carey.
Toe your doctor mentioned. Toe your doctor mentioned.
Yeah, I'm not... No, sorry, yeah.
Sorry.
Come on through.
Thank you.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah, yeah.
That eye's watering as well.
Runny nose?
No, blocked.
Blocked nose as well?
Yeah.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No, it won't be,
at any
love,
point.
no. Won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you
definitely,
most,
'cause,
isn't
well,
it?
even though it's me, and it, you know, like if I go like that.
Yeah. That's what it feels
I
like.
can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just seeing
Yeah, it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sleep if you want. Right, thank you.
Okay.
69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
Okay.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr.
All right.
James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay dropped down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
That's really blocked,
Not
isn't
that
it?
one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albas oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that should open it up.
Right, right.
Well, I'll go and do the prescription. I'll take Gemma with me, and I'll go and sign it, and she can bring it back for you.
Okay.
Is that okay?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. I think you hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
Okay, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
Okay.
And if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken so long
No,
today.
that's right. Thank you.
Take care.
Bye. Bye. Love.
Number 17. You're both together, aren't you? Yeah. Can I just take a brief indication as to what the problems are today?
Mine is for a repeat prescription, and also I'd like to see the doctor about the pain I'm suffering, because I'm like it's a constant 24/7 pain. And mine's for sick now.
So I can get you both seen together if you can either sit and wait until 10:20 or come back for that time.
Yeah, we'll come back at 10:20. Can you wait on it?
I will. Yeah.
We'll live across about 5 minutes. That sounds good. Similar like a sit and wait. And
Yeah, we did used to do sit and wait many years ago, but we decided to change because it was just too busy and not everybody was getting seen.
Well, where we used to live, they do still do the sit and wait.
Yeah, you see, we're a very big practice, you see. We've got over 23,000 patients, so if we did that, you can imagine how busy it would get. Lovely. So that's both your appointments this morning. You'll both be seen together, OK? Yeah.
Okay.
All right, no problem, thank you.
Here we are. There you go.
Hi, come on in.
Sorry, they kept me up there.
Oh, I know, that's why we know there's a bit of a queue sometimes in the morning. So, it was this thing here, wasn't it? Would you mind if I just refresh myself? OK. Right. OK, so we've done thank you for that. We've done a biopsy.
Yep.
It's come back as a little bit thicker than we would have, than I initially thought.
Yes.
So the plan today is to remove that completely.
OK.
Just show you. From what we can see, if it's that sort of area, the current guidance is to measure 4 millimetres in all directions, and then we remove all of that to a cuff of healthy skin.
Yes.
OK?
Yes.
Right. Right, I'm going to draw on you now, OK, just so we can get the boundaries.
I have to say, it's better than going to the dentist, this.
Yeah, I agree. Right, OK, grand. Right, here we go.
Little sharp.
3, 2, 1. Skin cancers can appear in various different forms and often in their very early stages can be hard to spot. Sometimes they can be just a small pink mark that doesn't settle or a scab that doesn't heal. In Barbara's case, she didn't have a scabbed area or a non-healing area, but it was clear to me once I'd looked at it down the dermatoscope that it was cancerous and needed to be removed. If a patient is concerned, then they must go and seek medical advice and get checked over.
You're doing really well.
So at the moment, I'm just doing the deep layer. Would you like one of my tomatoes? Do you like tomatoes?
Yeah, I do.
They're really nice. I think they're really nice. Have a couple.
Small, isn't it?
Yeah.
So how do you practice doing stitches?
On an orange. On an orange, you make a cut in an orange and then stitch it back together. Yeah, that's what I used to do.
So when I first saw those 3 little red, almost like pinpricks, how long would I have had this growing?
Well, it's a spectrum, really. It sort of starts off at some sun damage where the skin just doesn't heal particularly well. You get these little marks, and then you start to get little red or white marks, and then those can sometimes change into these things. Right, 5. What do you think, Karen? We're all right there, aren't we?
Well, I need the mirror now, you know, like you do at the dentist.
We haven't got a mirror, have we?
I'll see it when I take the dressing off.
Yeah, I'll just leave it like that.
Thank you for that.
No, you're most welcome. Any other questions?
No. I think
Right,
that's fine.
I'll leave you in peace to get yourself sorted.
Thank you.
You're most welcome.
Come and have a seat. I'm Becky, one of the nurse practitioners.
Hiya.
Hi, I think we've met before, haven't
Yeah.
we? Yeah. Hello there. What are we doing today?
It only happened yesterday. She was a bit chesty.
Yeah.
And then last night I was watching her breathing. She was struggling, you know, like breathing really badly.
Okay. And she went in hospital, didn't she, last
Yeah.
year, did she, when she had bronchiolitis then?
Yeah.
Can.
She's got a high temperature, so I'll give her Calpol at 7:30.
Okay.
I'm clapping.
Are you clapping? Hey? And has she been coughing, runny nose
She's
or
had
anything?
a cold for about 2 weeks.
Okay. Right, sweetheart. Do you want to start getting her undressed and have a little look at you? Right, we'll listen to your heart, aren't we? Hey? I'm gonna pop that there.
No, it's...
What's that cough been like?
Barking.
More like a bit of croupy cough, really. So we're going to give her these tablets now, and then we're going to repeat it in 12 hours.
Right.
So do what you're doing. Paracetamol, ibuprofen, lots of fluids, wet nappies and things, OK?
Yeah. Right, that's fine.
Yeah. But we'll see what she's like this afternoon, and then we might just have to see her again tomorrow as well. Just
Yeah,
to make
that's
sure.
fine. That's
Is that
totally
all
fine,
right?
yeah.
OK, I'll get door for you. All right, sweetheart.
Thank you ever so
We'll
much.
see you later on.
See ya.
Bye-bye now.
Sylvia, please. Hiya, Sylvia.
Hi.
Come through. Come in, Sylvia. Please take a seat.
I'll have to take my coat off. I'm absolutely cooking.
My name's Dr. Eunice. I'm one of the GPs working here.
Yes.
How can I help?
But I cough and cough and cough. And then the sneezes come. It's uncontrollable. I can't stop it.
There's a lot of different causes for cough. One of them is an infection.
Yeah.
Can we have a look? I think
Yeah,
that'd be
of
the
course
best
you
thing.
can.
So let's check your temperature first whilst you're seated. We'll check your temperature and your oxygen level. And then what we'll do is we'll have a listen to your chest.
Please.
You've got beautiful earrings on, or studs. 36.8 temperature, that's fine. This tells us how well you're breathing. So your oxygen level at the moment, 98%, which is very good. And your pulse is 67, which is perfect as well. So what we'll do is we'll pop you on there, flip up the curtains round. We want to have a listen to your back and I want to have a listen to your front. And if you just take a deep breath in and out through your mouth for me, honey. Gonna tap on your chest. That's okay. Can I have a listen to your front as well?
You can.
Do you want to pop up behind the curtain for me, honey?
I'm just kind of coping because I lost my husband in end of May.
This year?
Yes.
Oh.
And he'd been in hospital before, you bring them out. And this time he went in and he didn't come out. So it was
Must have been a
bit
shock.
traumatic. Yeah, it is a shock. He had internal bleeding. And obviously heart failure at the end, of course.
It's horrible losing a loved one, isn't
is,
it?
yes.
And I think nothing can sort of replace that bond.
No.
How about you in terms of friends and stuff? Are you getting out?
Well, I do some voluntary work. I've done it for up to our 12th year.
Mm-hmm.
There's a church thing that has babies and mothers and carers come.
Good
they come for
like
an hour.
a huge community, isn't it?
Yes,
Yeah.
I worked as a nursery nurse all my life with children, small children. So I've been very fortunate.
In terms of your chest, when people are coughing and coughing for a long time, I want to make sure that we've had a recent chest X-ray just to make sure that
No, I haven't
that all
had one for a
sounds
while,
okay.
yes.
So I think let's get a chest X-ray
Yeah.
done. Listening to your chest, I can't hear signs of infection. No. And your oxygen level was 98%. You know,
good,
all of
isn't
that
it?
is very good.
Yes.
Yeah. But obviously,
Good.
if you do start bringing up the phlegm that you can see, or
Yeah.
things are getting worse, we want to see you again. But right now, touch wood,
That's lovely.
you're fine.
Oh, that's lovely.
And I hope it continues that way.
Yes.
Is that okay?
Oh, that's brilliant.
It's lovely meeting you. I'll pop this on. Do you need any help?
No, I'm fine, love. It's just I'm careful with this shoulder. It's a pleasure to meet you.
It's a pleasure to meet you.
Yes, and I'm very reassured with that.
You are a delight, Sylvia, honestly. Pleasure to see you. I'll leave an X-ray form out in reception for you.
Yes.
Out that way and down.
Thank you, dear.
She is lovely.
Take care.
Bye.
Thanks. Bye-bye.
Thank you very much for your help.
Cheers.
Take
You
care.
Take care.
Bye.
Thanks. All the best.
Thank you.
All right, see you later. Bye-bye. All right then, thanks a lot.
Take
Bye.
care now. Bye-bye.
Think about your body a bit like a car. It's got to be looked after. It's going to go wrong from time to time, so you take it to the garage.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
Where are you talking about? Is it the skin, the vagina?
Right there, like a little paper split.
Okay.
Who was it who you hit?
My friend, who's the security guard, he does that thing.
Yeah.
And he doesn't want to climb them and kill them. What is that, Jones?
At 10:30, Dr. Opon.
Opong. O-P-O-N-G.
OK, bye. What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
OK.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel that I'm going to pass out.
Tell me about when you go for a wee.
It's very uncomfortable when I go to the toilet.
Around your groin or the testicles or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can.
Is it tender at all?
So you say you're having bubbling urine?
Yeah.
Hi, my name's Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard. I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that. You know what I mean?
So let me just check that I've understood this right, Brian. Yeah. So at the moment you're finding that you're feeling a lot more tense and angry at the moment at the world.
Very angry, that's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's right. That's what is causing it mainly.
Okay. Do you think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people. No. So, is something making it a bit harder for you to tolerate people at the moment?
Yeah, that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, you know, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, you know. You know, and that's it. That's upsetting.
Yeah.
And he doesn't want to grab them and kill them.
The NHS computer system is absolute crap. I can't get into my computer. It doesn't like my...
No, that's what you go on at the beginning, isn't it?
Yes, well, that's what I was trying to get in on that.
That's not that one.
Yes, it is. I can't understand starting late.
Now it's doing it. That's your card code.
That's the number I always do.
Yeah, so you're going into it now.
No, we're not. Not yet. Don't be so optimistic. You're not in until you're in, Chris.
All right, so... Yeah, you are swollen, aren't you? OK. I'm just going to lift up to see underneath. Where was the cut you saw?
Just right about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yep, that's absolutely fine, Doctor.
OK.
OK, then.
All
Thank
right.
you very much.
Mind how you go.
Cheers.
Bye-bye.
Don't touch anything.
No, not until I can see
Don't
it on
touch
the
anything.
page.
You're in, you're in.
No, it's not yet.
It is. It
Not
is.
yet. Wait.
It's in. Why does it do it? I don't know. It hasn't done it for me.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit
Well,
more?
that's why I've come to see you, really.
Yes.
We need something to sedate me, or, you know, not to put me out like that, you know.
Yes.
But something milder, if you like, you know.
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took a Lanzapine for a period of time. That's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing that should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. You know, I don't want no convictions or no violence at all in my life, you know. I don't want to shoot someone, like my doctor or anybody.
Well, yes. Say ah for me.
Wide as you can. Say ah. Okay, say ah.
Look at me.
Say ah.
Ah. Good.
Say ah for me.
Look up for Daddy. Show him the back of your arm. Say ah. Ah. Roar again. Say ah. Okay.
Say ah again. Okay. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, eh?
The TV and all that is a voice, you know. So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space.
Okay.
And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
You get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up there.
But you're not thinking about doing it.
And your knees.
But you're not thinking.
And your knees.
Right.
And stabbing the knife in your leg.
Right.
And saying, here, feel that, you twat, you know. Feel this, and you know, and all this, you know, which is dangerous and self-harm.
Yeah.
Right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me. No.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that'd be great.
Okay. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, you don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
No, okay.
Okay.
Well done, mate. It's all good, you know.
Indeed. All right, let's help you gather your things up. Right, Ryan.
Thank you very much.
All the best. You're going to be okay finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
How can I help you today?
It's got a bit of a lump under my chin. You can have a go on it if you want, it's just there.
To me, it doesn't feel like anything sinister.
Cool, thank you.
Come and have a seat. How are you?
Okay.
Okay.
Fine. I feel fine in myself, yeah.
We had some results to go through. Is this why you've come?
Yes.
I hope so. Yes. I tested you for diabetes. No signs of that. Blood count, no anemia. Kidney function, fine. Cholesterol level, no. It's 6.7. The upper end of normal should be 5.
Okay.
It's a measure of the sort of fat that's floating around in your body, and we get excited about it because we know it's one of the big risk factors, fat and blood pressure and smoking, for heart disease. I suppose the first thing to say is, what's your diet like? Vegetables.
Yeah.
Vegetables and fish.
Vegetables and cakes.
Got to have some naughty days. You can't say no to cakes completely. But actually, cakes are what we call quick fixes. You get a sudden burst of sugar, but it doesn't last. If you were to take your carbohydrates in the form of something like, say, porridge in the morning, that'll keep you going because it's releasing the sugar slowly. So porridge, cereals, pasta, they're all releasing their sugars slowly.
If only there was a magic potion or something for weight, eh?
Yes, there's no magic wonders for weight. But diet, losing weight and exercise can actually reduce your cholesterol levels.
Yeah, I know exactly what I should and shouldn't be doing, so I'll give it a go and I'll try.
Give it a go. You can actually get 12 weeks of free Weight Watchers.
Wow.
Just think about it.
Yeah, definitely. I can see you.
Okay?
Okay, meet you soon.
Good, bye-bye. I hope she does something about it.
All right, so that's 5 o'clock then. Okay, thank you. Bye-bye.
I've got my thing tonight, innit? My Weight Watchers start tonight. Excuse me, please. This is my area. I can't breathe. That's why you go Weight Watchers. Oh, leave me.
And my stomach, yes, most times there's pain in me. Yeah.
Do you get any feeling like being sick, vomiting?
No, I just feel pain. I'm feeling pain.
How's your weight been?
My weight is all right.
Yeah. And how about your appetite?
Yeah, it's okay.
Any diarrhea?
No. Blood coming out sometimes.
Blood?
Yeah.
Is it in the toilet bowl, the blood?
No.
So it's only when you're wiping?
Yeah.
Yeah. Because of the symptoms you're having, would it be okay for me to examine you?
Yeah.
So I need to check your stomach.
Yeah.
The other thing is because you're having bleeding from your back passage.
Yeah.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
No.
Okay. Now I'd need to take a look at your back passage. And obviously I'd have some gloves on. And then using some gel, I would examine your back passage with my finger.
No problem.
Okay. Are you okay for me to do that?
That's fine.
Do you want a chaperone? Are you happy for me to go ahead? Do you want someone to chaperone while I do that exam?
Yeah.
No, do you want someone to be in the room whilst I do that exam?
That's all right.
Okay, so first I'm just going to take a look at your stomach.
Okay.
For all intimate examinations, we would offer a chaperone to people. Because quite often your patients might come to the practice with a range of different symptoms and they wouldn't expect to do a personal exam because that's maybe not what they had in their mind. So I'm just going to gently press. Just a sec. Lie on your left-hand side, yeah? And then let me know when you're ready.
I have to take my gloves off, yeah?
Well, you can just lower them just so I can see your back passage, essentially. Tuck your knees up towards your chest. I wouldn't say it's difficult to do an intimate examination because it's something that you do throughout your training, so you do get used to doing intimate examinations. And that's why it's important that you're reassuring the patient that this is actually quite a normal thing and there's no need to feel awkward about it. Okay, so I'm just applying some jelly to your bottom end. It'll feel quite cold. And now I'm just gently advancing my finger through.
Yes.
Okay, so if you want to get dressed and then come back outside.
Okay.
Yeah.
I don't know what's causing that blood sometimes.
You've got a pile, which is what's causing the bleeding. Have you heard that term before, hemorrhoid?
That's what I was thinking.
Okay, so around your bottom end, you've got quite a lot of veins there. They carry blood, essentially. So sometimes when people get symptoms of, say, constipation, as such, have you felt constipated yourself?
Yeah.
You have been? Okay. So I can give you symptoms of bleeding. So there are different things you can do to try and help those symptoms.
Yeah.
One thing is eating more fibre in your diet. There are some creams that I can prescribe for you that you could apply to your back passage to try and help those symptoms as well.
Okay.
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 Yeah.
Hello, this is Dr. Ferdinand calling from St John's Medical Centre. You know, we took a couple of urine samples from you last week. They came back negative for chlamydia and gonorrhea, so there was no evidence of those.
I can't sit here and tell you that you definitely don't have prostate cancer, but at the same time, you're within normal range now, which is fantastic. You brought that right down.
They did a lot of random biopsies, and your IBS-like symptoms are just IBS. They're not colon cancer.
That's fantastic news. Thank you. Thank you.
We're in business.
Yeah, it's normal. Okay, thanks. Bye. It's normal. Your chest X-ray is normal.
So, last time I saw you, you had this problem with your toe.
That's right. And I went.
And I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
okay?
Yeah.
So
it's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Diabetes is a serious diagnosis because it's such a wide-ranging condition. The fact that the sugars affect your eyes, affect your kidneys, and diabetes is in itself a risk factor for heart disease.
Right.
Yeah, it's not something to be taken lightly, but at the same time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes. Plus, I'm a drinker, so will that be knocked on the head or?
What do you drink?
Mainly lager.
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially a pint of lager.
I thought that,
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites.
Yeah, so...
Because that's my living, I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars because, I mean, we're talking about the rest of your life, 30 odd years. We need to get this diabetes under control and it will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. I'm going to give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control.
Do your fist for me.
I've got a pinch and inch. All right? Keep your belly nice and relaxed, okay? Very good.
All right, sharp scratch.
Right. Any allergies to anything that you're aware of?
No.
High blood pressure?
No.
High cholesterol?
No.
Thrombosis, clots in the legs or the lungs?
No.
Diabetes?
No.
Glaucoma?
No.
And breast cancer? No. Have you ever had HIV screening?
I think I did, but it was years ago.
Right. Do you want me to do it today?
Yeah.
Yeah? Let me feel your hands. Are you warm? So this is an instant result.
All right.
1 dot is negative and 2 would be positive.
When I had my eyes tested and he's in there saying to me, well, you could do with losing weight. I said, yeah, mate, I'm 66.
Yeah, oh no. Can't be doing that.
Donuts. Mate, no. Nice to see you anyway.
And you haven't seen you for a long time.
I don't come here a lot, do I?
I don't blame you. Take care. See you soon. Bye.
There you go, you've got a nice negative dot there.
Phew.
It's amazing how many people suddenly think when you say to them, oh, it's a test, you can have the results straight away, they go, oh, OK. What, you mean now? What about chlamydia screening? Have you had chlamydia screening recently?
Not recently.
Do you want to do that as well? You can do that yourself.
Okay.
What you do for that is you just go to the toilet, wipe yourself, pop that much into the vagina, woohoo, and then in the pot.
Okay.
All right, and the toilet's right opposite.
Hi, is it Miss Strong? Hi, please come in. What can I do for you?
I'm here about my coil.
Okay.
I've had in over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had...
Fine. I mean, the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case.
Post.
So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
I've had the menopause.
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it difficult. But that's some people. Yeah, the menopause affects people in various different ways.
The hot flushes, I'm not really too bad on that. I might get the one maybe a month, if that.
Yeah, no, I don't get the hot flushes.
So I don't get the hot flushes really and truly. I don't experience that. But what I've noticed with myself is that I'm so snappy.
Yeah, me too.
Bad-tempered.
Yeah, me too. Yeah.
It's like I want to kill anyone who gets... It's not even funny because it's like... I have to check myself sometimes.
Yeah,
do you know what I mean?
Of course. It's not sure somebody will say to you, why did you do that? And you think, did I?
Don't know
that you did.
It's got to be menopausal.
Was there anything else you wanted to ask about? Was that it today?
What's this at? I know it's like having, my vagina in there. You know that bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
What? Rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay, and does it bleed?
No.
Is it just very sore? Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink, and you can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or irritation, things like that.
Yeah.
Does that make sense?
Yeah.
All right.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I get a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
OK. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes, so it's the pain that you can make worse by touching it.
Just by touching it.
Right, may I check your blood pressure, please?
Yeah. Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar, I've never had them before.
Is there anything else going on in your life that you
I'm just down all the time, constantly. And I'm going today to, would you call the people the psychologists?
Yes. Are you worrying about that?
It seems strange, you know, I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that, do you know what I mean? I feel a bit worthless and a bit silly.
OK, we could look at it a different way round, though, couldn't we? Think about your body a bit like a car that has to be serviced, it's got to be looked after, it's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah,
and the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong, it's just a little bit of a loose this, that or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons we thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse?
You know, this headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first
underlying
place.
Thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope.
Seal it up.
And seal it up. OK? And concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what I mean? And I
yes.
think, well, I'm going to be 69 this year and I still feel quite good. Do you know
Absolutely.
what I mean?
Keep on with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Yeah. Not bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes, I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
How are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Is it hard?
Sometimes.
Yeah.
Yeah, sometimes.
What's happened recently to make this the worst day of your life? OK. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Now, he can be a bit squiffy for a few days with this, all right? So if he's a bit loose, don't worry.
You've got such a hard life.
Oh. Right, so sit him like that, nice and relaxed, yeah?
Yes.
OK.
I'm trying to be.
Well, you're doing very well.
Right, I'm not going to look. So
No,
tell
just
me when you're doing it.
Relax, just relax, OK? He's going to...
My heart is beating.
It's all right. All right. You're doing well, you're doing well. Sorry. There you go. It's all done, look, see? Oh.
All right.
when somebody wants me to hold their baby for them, I can feel just as nervous.
Okay, have you got some tissue, please?
Yes, darling. Oi, mister. I'll get away with you.
All right, Mummy's sorry.
4 weeks' time.
What's he got to get done then?
He has his second diphtheria, tetanus, and his meningitis C. And he has.
Injection?
Yeah.
Gosh, I can't do it.
Look, he's all right now. He's just whinging now. You're fine. Man up. Come here, give us a cuddle. What you like? What you like? Hey? I've always been able to communicate with children. You see them evolve, and one child, she wouldn't even come in the door. She'd sit in her buggy at the door, and I'd say to her mum, just leave the door open, that's fine, she can stay there if she doesn't want to come in. And then the next time she came in and she stayed in the buggy. And then I've met that child all the way through, and now she's an adult working, and I still bump into her, and we get on really well, and I've seen her develop as a child into a young woman, and it's great. Right, what time do you want? 9:30?
That's perfect.
Are you all right there, your hand down my cleavage, mister? My dog does that.
He does that all the time. It doesn't matter who it is, he does it.
We've got to let them develop. And that's what I love. I think they're so funny.
Thank you.
Are we going to get a smile before you go so your mummy knows you're all right? Look, he's fine now.
Did you have a problem with your medication? Uh-huh. Okay. Okay, you're welcome. Take care, bye.
Hello? I'm still limping. You're still limping, Ian?
Yeah.
Is it no better at all then?
No, the lump's not gone down at all, really. They phoned me up this morning saying, can I come back to work today?
No, you can't come back to work.
They want me back this morning.
They warned you back?
Yeah.
Come in. Hello. So, you mentioned the lump.
Yeah.
Let me see it. So whereabouts do you feel your pain?
It's around there.
It's around there?
Yeah.
OK. It's been a little over 2 weeks now, and the pain's no better at all. If you come lie down, I can work out whether it's your hip or your knee that's causing the problem. Right. So bend your knee for me. Hang on. Relax. Just relax. Let me move your knee. Can you bend your hip a bit more as well?
No.
Does your hip come up any higher?
No, that's how high it comes up.
That's as high as it goes. All right. Does that hurt?
Yeah.
Can you sit? Can you sit on the edge of the couch? Might be easier if we get you to sit. Great. That's all right. Just. Oh, does that hurt? Sorry. Yeah. Let's get you up. Sorry.
That's all right.
Didn't mean to cause you discomfort. I think the problem's your hip, because your knee seems to be moving quite well.
Yeah.
And it's your hip that's actually really struggling to get much movement out of.
Yeah.
Would you agree with that? Or?
Yeah.
I think maybe we should get you referred to see the specialists about your knee and your hip.
Right.
All right, Ian. Yeah, do you want a tissue?
Right.
I take it you're not too keen on the idea of having to have further operations?
Oh, I'll be right. Last time I said it was 50-50.
Hello, it's Dr. Parker here at St John's Medical Centre. Right, he said he did want to have counselling, and I genuinely believe he hasn't been taking crack since then. He still takes cannabis, but then a third of the people that live around this surgery take cannabis, so that's nothing new.
OK, but it's really important you try and avoid the marijuana. The strong stuff or the weaker stuff, it's still best to try and avoid altogether. OK, take care. Cheers, bye-bye.
If you want to try to avoid an operation, then the thing to do instead would be to have some physio and seeing if that helps.
Yeah.
But Unfortunately, arthritis tends to be progressive. It tends to get worse with time anyway. So, I mean, would you like to try some physio first, or do you want to be referred for...
I don't mind being referred to see the doctor again.
You'll see the doctor about maybe having the operation?
Yeah. Can I go back to work yet, or not?
At the moment, do you think you'd be able to manage the pain?
No. They wanted me back this morning.
I know. Maybe if we give you a couple of weeks more off, and that gives enough time for hopefully the knee and the hip to settle down a bit more.
They want it straight away, they said. They won't get paid otherwise.
We'll take that then, quick. So that covers you from the 10th up until the 24th.
Yeah.
Yeah, I'll get the paperwork sent off. I'll ask them to see you as soon as possible. Okay?
Yeah. Bye-bye.
Bye-bye. Take care.
See you later.
Bye.
Mr. Tappenden, hi there. What can I do for you today?
Yeah, basically what it is, look, I'm a diabetic, so my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or 6. I mean.
Yeah. So they really have shot up.
Yeah.
You've had quite a few urine infections. Is that right?
Yeah, on and off. Yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning since
It burns?
Yeah.
Okay. And are you peeing more often than normal?
Yeah, more often, yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in there?
No, it's not blood.
Right.
It's not blood.
Any cough or difficulty breathing, headaches?
No.
Rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No.
Okay.
Yeah, they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait and take it from there, okay?
Yeah.
There's a lot of glucose in your urine.
Yes, sir.
But there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often, is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although I don't think that's what's happening.
No.
All right? Okay.
Okay, yeah.
Take care.
Okay.
Nice meeting you.
So I just need to examine her.
Yeah, that's fine.
Hello, cheeky.
Think of the 3 pigs and the wolf outside going huff, puff, blow your house down. That's the house. In. Get out of it. Try again, go on.
And if you were going to score it, say 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion.
Easy.
That's it. Well done. Well done.
Hello.
Yeah, please. Jordan, this way. Jordan, no, this way.
What's up with Jordan today?
Right, I've just got a little problem. The way he's behaving, I'm just wondering, has he got some form of autism? I was reading on the internet that kids that line their toys up, line up their toys, because he does it like all
Lining
the
up the
time.
toys. Okay.
And he knows all the planets. You know, he just lined them up. Jordan, no, come this way. Jordan.
Okay.
Sit down. Okay?
What else?
And sometimes he's like this. He just laughs unconditionally. Jordan, can you stop?
And how does he get on with the other kids his age?
Fine. Teacher said he's fine. You know, Jordan, can you stop, please?
If Jordan wants something, can he tell you about it? Can he tell you, I want this book, I want that book, I want to watch this, I want to do that, I need something to eat, I need something to drink?
Yeah.
I mean, you're right, autism is a spectrum. It goes from very severe to barely noticeable, to be honest. What you described about being quite obsessive about one thing, about ritualistic behaviour of lining things up. Those are two features of autism.
Yeah.
But there's also features of normal 5-year-old kids as well. Okay.
The internet has a really interesting role in healthcare. I think once people have their diagnosis, it's very easy for them to then go away and research what the treatment options are themselves. And that's great. I really welcome that. I want my patients to be really well informed about their conditions. But I think the one thing that the internet's not very good at is diagnosing. Usually if a patient has tried to diagnose themselves on the internet, I'd say 9 times out of 10, they're probably wrong.
Autism is a social communication disorder. It's your inability to be able to interact and socialise with the world around you.
Yeah.
It sounds like he does fine.
Yeah.
To line up the toys, that's every kid does that. Lots of adults do that. We will line things up just because that's the way we are. It doesn't make us autistic, it just means that is a little idiosyncrasy of some people's behaviour. He seems like a pretty normal 5-year-old to me. All right?
Thank you.
No problem.
Jordan, come on, time to go. Say thank you to Doctor. Thank you.
Bye-bye.
Bye.
It's time for the weekend.
Right, I've put that in for you. You're welcome. Okay, bye. Bye. This patient was so happy that she got an appointment at the time that she wanted, but she goes, oh my God, thank you, darling, God bless you. What are you doing this weekend?
Watching my TV with my teddy bear.
The guy told me that half of the heart is not working.
Yes.
I stood up and all of a sudden I felt I was drowning.
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That is where I do have the pain.
When was the last time that you had sex?
It's a month ago.
Was it with a regular partner?
2 people besides this girl, but they're all regular. Oh God, getting pain, getting worse and worse and worse. I can't understand it no more. I can't even sleep.
Good morning, surgery. Good morning, St John's. Can I help you?
Could you come for this morning, 9:20?
Your breathing seems a bit better.
It is.
Good.
So I've had a few days where I've gone and not had any cigarettes, but then there's been other times where the craving's just been like so much that I've had one, but after a couple of, just took a couple of pulls and thought it's disgusting and kind of just got it out of my system.
Where are you getting the cigarettes from to have the odd one?
Well, it just happens to be a drawer.
Right. Which I'd like you to go home today and have a ceremonial emptying into the bin.
That's the fear bit, because I'm thinking, what if I really, really do need one?
If you were addicted to heroin, would I say to you, go and just put 5 ounces of crack heroin or whatever in your drawer just in case you need it. Would I say that to you?
No.
So why would I say that to you with cigarettes?
You wouldn't.
No, you wouldn't, would you?
I'm saying it to myself.
Again, it's another thing. You're setting yourself up to fail.
Okay.
So get in there and be
All right.
positive.
I will do. Promise you.
Right.
I'll go home and get rid of it.
Get rid of it.
What's the date of birth?
8/10/35. No, just this, sorry. 8/10.
Can you bend forward and touch your toes for me? Great.
Ow!
And up.
Sharp pain. It's like every time I move, stabbing me.
How severe would you score it on a scale of 1 to 10?
I would say 9.5.
How much movement have you got in this arm at the moment?
I have movements in it. Ouch.
Hello, sir. Good afternoon. Go on in. How's 2014 been treating you so far?
Well, in December, I spent 16 days in Lewisham Hospital.
Very sorry.
And now I'm on oxygen.
You're on oxygen at home now, are you?
16 hours a day.
So how are you finding that?
Oh, there's been lots of funny things happen. Your nose runs. Initially, it was bleeding. My throat's gone. No, it was not very funny, really.
No.
Not at all.
It's not a nice thing to happen.
What shocked me was they said I had pneumonia.
Well, yes.
And I'd come down with a cough, and I had pneumonia and a heart attack. But it was the breathing bit that got me, because I don't know what it's like to drown, but by golly, that was the impression I got on that Friday morning.
Yes.
I stood up, and all of a sudden I felt I was drowning because I was trying to grab air, and my hands were going, trying to. It's frightening.
I think my biggest frustration is feeling that I can't help my patient because their problem is too complex. The key thing that we do is we listen and we try to understand what problems that the patient is coming to us with, and we try to work with them to try and find the best solution.
The guy told me that half of the heart is not working, and it's not being able to pump the blood round, so it's the lungs are not functioning properly to do the job.
Well, look, put the jacket on. Let's have a listen to your chest and see what's happened. See what's going on. Deep breaths in and out for me, Brian. Good. Turn around for me. Let's have a listen at the back as well. Okay, deep breaths in and out. Good. Have a seat for me. Your chest sounds good. It sounds clear. You're getting lots of air in there, and so that sort of ties in. You can breathe. You're not feeling short of breath. That's all very positive. I imagine that the cause of a cough is the oxygen. It's drying things out and making you more likely to cough. I think the heart failure nurse is the right person to ask about getting reassessed to see if it's really needed or not, because it sounds like it may not necessarily be needed.
God, it's been a long 6 months, and I'm quite honest with you, it did bring me down.
Yeah.
And no one seemed to care anymore. I still don't, but what the hell?
Right.
Anyway, doctor.
All right, Brian. Nice to see you. Take care. If you're having problems, call me, yeah? You don't have to always come down. Just give us a call.
You take care, mate. Bye-bye.
Bye-bye.
Make sure you're doing enough weight-bearing exercise, walking, skipping, running, whatever you want to do that's weight-bearing.
The symptoms are classic of asthma. Nocturnal wheeze, chest tightness.
It's positive. You're pregnant, my dear.
We're talking about signs of serious infection. Drowsy, dopey, can't wake her, or the opposite. Hey, what's up? What can I do for you today?
For the past week or so, I've been getting really bad headaches. And then it kind of started to get worse Monday when I started to get migraines.
So when you say it started as a headache and then became migraine, what do you mean by migraine?
Migraine as in severe pain either at the front or the side of my head, and I usually always end up throwing up.
Is it a constant headache or is it coming and going?
It's a constant one. It's been constant since Monday.
At its worst, what sort of state does it reduce you to? Are you having to get into bed and...
Yeah, literally, I will be in bed with the duvet over my head.
Okay, and any other symptoms like cough, runny nose, diarrhea?
Diarrhea, yeah.
You had a bit of loose stool as well?
Yeah.
Okay. One more question. Is there any chance you could be pregnant?
Morning surgery, Stacey speaking. How can I help?
I have to see a doctor tonight.
Yeah, I will ask the doctor, but you are 35 minutes late and you may have to rebook.
When was the first day of your last period?
It was the middle of last month.
So that would make you a little bit late, maybe? Do you often miss periods?
Yeah, because of my pill.
Oh, right, okay.
Yeah.
And are you pretty good at taking it at the same time every day?
Yeah.
You don't forget? No. Just to be on the safe side, I think it's worth doing a pregnancy test. Do you think you could pee for me?
Yeah.
All right, if you take that to the loo and then just come on back straight to my room.
Hello, good morning, surgery. Can I help you?
Seems to be very busy at the moment.
I can see that.
Come in. I think what I'll do is send your urine off. There's just a little trace of white cell, which, you know, in the absence of any definitive diagnosis, and especially you're a bit tender over your bladder, we'll send that off to make sure there's no infection. But it's difficult to say whether the headache's causing the nausea or whether all the diarrhea and nausea is causing the headache. Yeah. What we can do is maybe give you some anti-sickness tablets, see if we can set things down, give you some painkillers, and then see how you get on.
Okay.
Pregnancy test is negative.
Don't need a kid yet.
Good morning, St John's Medical Centre. How can I help?
Now, as I've explained to you, and I'll explain it again, there is no appointments with Dr Vash till Wednesday.
You're breaking up. I can't really hear you. I'm getting an odd word here and there.
I can't hear you properly, sir.
Do you know what? I can't hear you at all, I'm afraid. It's a very bad line.
You can have 3:40 or 4:20 this afternoon with Dr Nav. Would you like that appointment?
I'm Dr Parker. What's the matter with you?
I fell quite badly and I hit my knee, my leg and my ankle. And after, well, it was a bit painful, of course, for the week. But then when I woke up Sunday morning, there was like a blood effusion inside the knee, so it was like all black. I couldn't be sure that if it was
So
because
you
of
fell on the ground?
Yes. And then there was some gentleman kicking me. And I can't be sure if that was because of the fall or the other person.
Your head wasn't injured?
I had a slightly kick as well on my head.
You weren't knocked out?
No. And ankle as well is still a bit blank, and I think it's still swollen.
Shall we have a look at them, I think?
Sure.
Does your job involve walking or standing?
Yeah, I'm a waiter.
Yes. Yeah. But is...
I've been working all week and I've been walking. The walking is not really a problem, standing.
It is, yes.
It's
good.
not.
OK, let's pop you up on top here and have a look. One of the things that you ought to do straight away is put some ice on, because it stops the bruising, it stops the damage to the knee. And now I'm going to ask you to take your trousers off. That's a pretty colour, isn't it? My goodness. I'm sorry if my hands are a bit cold. Fortunately, I think there's no fluid in the knee joint at the moment. If I move round here, is that hurt? And what about the back? Is that all right? No. Now, I'm going to take it like that and I'm going to twist it. OK, now, I'm going to just pull on your leg. And I'm just going to push.
It's okay.
Look, I think this is just bruising. That means soft tissue injury, no broken bones. I don't see any reason for sending you for an X-ray. So I think that's just going to get better on its own slowly.
Come in. Hi, Len.
Oh, yeah.
Mr. Lennon, good to see you. Sorry I kept you waiting such a long time.
Is it possible to get a glass of water, or I feel a bit faint?
Yeah, sure, take a seat.
I feel really lightheaded.
Not a problem, you take a seat there, I'll be with you in just a second. I've got a patient with me, but
Oh, right.
you can bring him in if you
OK,
like.
I'll move them into my room and then I'll come into your room when you're finished, all
OK.
right?
I feel really peculiar all of a sudden, I don't know why.
Have you been feeling like this all day? Is that why you've come to see me, or is it just happened now?
No, it just happened out loud. I just come over and I feel like lightheaded.
OK. Ever had an episode like that before?
No.
Ever fainted?
When I cough too much, I faint. I pass out, which has happened, I don't know how many times, but...
Any feeling of your heart's racing at all?
No, but I'm getting all hot and I feel a bit sweaty and cold and I don't know.
OK.
Very odd.
Do you mind taking your jacket off in a minute so I can just check your blood pressure? What was it that actually brought you here to see me today?
I'll need my doctor's certificates run out and I need some of my tablets, some more tablets. Oh, sorry, I feel really strange.
Just relax. OK, just roll your sleeve up for me. OK, do you mind just standing up for me? If you stand like that... You do?
Yeah.
And is it a definite dizziness, or is it the actual room spinning?
I feel lightheaded. I don't know. I can't really explain it.
Sorry, let me just get this.
I've been sleeping funny as well. I haven't been sleeping too well.
Do you find yourself falling asleep? Like at times when you wouldn't expect to fall asleep?
Yeah.
Do you mind just sitting on the edge of the bed for me? And anything else changed in your life over the last couple of months?
No.
No? Got into any bad habits? Drinking too much, or...?
I do drink beer every day.
How much alcohol do you drink?
About 5, 6 cans.
5, 6 cans. Of what kind of drink?
Stella.
Stella. So that's, what is that, 5.4% or something?
5.
5%? Yeah. OK. Would you consider that too much alcohol? Do you know that's bad for you?
Yeah, I know it's too much alcohol.
How long have you been drinking that much, do you think?
I don't know. A long time.
6 months? A year?
More than that, probably about 8, 9 years.
Do you drink alone?
Yeah.
OK. And do you live with anyone else?
No, it's by myself.
OK. Do you mind just sitting down, lying down flat for me?
Yeah, there's a little bit of pain there.
Yeah?
A little bit.
I think, if I'm honest, I think there's a few factors. Did you have 5 lagers last night?
Yeah.
I think if you've been drinking 5 lagers, cans of lager every night for 9 years, you've done damage to your liver.
Yeah.
Giving bad news to anyone isn't an enjoyable part of the job, but unfortunately it's something you have to do on a regular basis, and there's no beating around the bush. You have to be completely honest. It's definitely a regular part of the GP's job.
If someone drinks that volume every day, you can't just suddenly stop because you can get into problems with withdrawal. But you certainly do need to cut down, and that might be changing the routine from 5 drinks a night to 4 drinks a night for a period of time, down to 3 drinks a night, and take it from there. I can't tell you that you want to stop, but if you feel like you're ready to stop or you want to think about cutting down, these are the people that are going to be able to help you. I mean, does that sort of scare you, or does it stress you out, or what are your thoughts on what we just spoken about?
Yeah, it does kind of scare us, because I know I'm drinking too much. But I think it's just because I'm always in my room, my bedroom. I never go out, I never do anything. My legs always get giving away, or one day it's okay, the next day it's not. I think it's just that, because I've been like stuck in the house for like nearly 2-3 years now, you know, not being able to do anything. So I go out now and then, but not as much as a normal person would for my age.
I'm sorry you had a tough time lately, but I'm glad we've kind of stumbled upon it almost by chance, because it means that we got the opportunity now to try and improve your situation a little bit, not just with your health, but also with, you know, how you feel in yourself and your outlook in life in general, really. Our priority now is to get the blood test done, sort out, see where we are with the liver situation. But next time I see you, hopefully you'll be able to tell me that you've cut down a little bit, and then we can take it from there.
Any alcohol?
Yes.
On average, what would you drink in 1 week?
Probably 5 or 6 pints of beer, I'd say.
Would you have 8 or more drinks in one sitting?
8?
Yes.
No.
When you're drinking every day, the risk can be high, and the liver doesn't tell you it's not well until it's really, really not well.
Good morning. How are you?
What's different to this one and this one?
The Meprazole 20 milligrams, and on the back of this it says that this is a Meprazole 20 milligrams. So they're exactly the same, but just made by different companies.
But different colour, that's all.
Yeah, but it's because they're made by different companies.
Yeah.
It's like Coca-Cola and Dr. Pepper.
Exactly the same.
Pretty much.
Exactly the same. Dr. Vernon, I can't help it no more, mate. I tell you. Getting pain, getting worse and worse and worse, mate. I can't understand it no more. I can't even sleep.
The likelihood is you have these things called adhesions in your tummy. Remember I said that?
Yeah.
So that's where things stick together and then you might get some pain from time to time. But it's very difficult to treat that sometimes. The MRI scan's an important part of it, and that will show up if there's anything going on.
I'm telling you, it's very, very painful. It's not only one here. It's here to here, right? Oh, God. I can't even understand it, doctor. I tell you, I bite my tongue up, I will. Because now this one not go away. Not go away at all, doctor.
So the pain's a bit worse than it was
It's
before.
getting worse and worse and worse.
Well, that's why it's important that you've had the MRI scan and now things will get followed up. In some ways, it's a bit of a pity you missed that gastroenterology appointment that I organised late last year.
I know. I can't help it no
Once
more.
I have the report, then I can decide where to refer you to.
Yeah.
Okay.
All right. All right, thank you very much, Dr. Vernon, yeah? Thank you.
Bye-bye now.
All right, thank you very much.
Take care.
What might be a good idea is just to announce, you know, that they're running late, so we're not just sitting there waiting.
How your water works? You peeing normally?
A bit more than normal.
Are you going to the toilet more frequently at all?
I do suffer from dribbling.
Yeah. Does he have any problems with going to the toilet when he goes for a wee?
No. No.
No, no problems there.
I'm Dr. Trin. What can I do for you today?
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That is where I do have the pain.
Is it there all the time, or does it come and go?
It comes and goes.
And when it comes on, does it feel like aching, or does it feel like stabbing or a shock pain?
Aching.
Aching, okay. Is there any problem when you pass urine?
No.
No, no burning, stinging, no blood?
No, no, no.
Do you ever get any discharge from the penis? Anything leaking from the penis?
No.
Any creamy anything coming out?
When I'm not peeing.
Okay.
No.
All right. I'm going to have to examine you down below. Would you like me to call the chaperone? Yeah. You want someone else in the room?
Somebody else in the room.
Because I'm a female doctor.
No,
okay, I will ask somebody to come in.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help?
The thing is, the baby clinic finishes at 2:45.
Hello. How much do you weigh?
I've got a patient on the line. Her baby is a year old and he's come up with a rash. She's quite concerned about it.
Can you point to where the pain is?
This.
Okay, so it's the it is the testicle.
Yeah.
All right. So I'm just going to examine here. Any pain where I'm feeling?
No.
Okay, all right. That's fine. Let's get you dressed again. There are lots of causes of that kind of aching pain. One of them is an enlargement of blood vessels by the testicle. So I think I will request an ultrasound. What we should do is maybe do a few more tests. I'd like you to do a urine sample for sexually transmitted infections, just to rule that out. Is there anything you want to ask me?
I was asked to do some tests.
Okay, so they were just some routine blood tests.
Yeah.
Fine, so let's have a look at the results. Your cholesterol is okay, liver function is okay, kidney function is fine, and we did an HIV test which was negative. The test, however, it doesn't detect if you've picked up HIV within the last 3 months because it takes that time window for the results to show in the blood.
Okay.
So, when's the last time you had sexual intercourse?
Say a year plus.
Okay, all right. That tells me that as of 3 months ago, there was nothing positive.
Nothing.
So, if you've abstained from sexual intercourse for that time, there's no reason we need to worry.
Okay.
Okay, so once you've had the ultrasound, give it about a week for the result to come back to us, and then book an appointment to come back and discuss the findings.
Okay. Thank you very much.
Okay, my pleasure.
Yes. Yeah.
Take care.
Thank you, bye.
Bye-bye.
Hello, Doreen, come in. How are you?
I'm not too bad, thank you.
Good, what can I do for you?
I seem to have been bitten by an insect.
Oh, where?
On the leg, I'm afraid.
Doreen, you poor thing. Put your foot up. You need the antibiotics.
Antibiotics?
Absolutely, it's
Okay.
spreading. Look, all that redness. The actual strong red bit's about 3.5 centimetres by 1.5. When did you...
Yesterday.
Oh, good. And that's come from yesterday?
Yes.
Did you feel the little biter?
No, I didn't feel anything.
You never see them, usually, do you? Well, it's pretty powerful, isn't it?
It is.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Sometimes it's worth even drawing a biomark where the line is, you know, like along here, because that should start to get smaller over the next 2 days. If it's not, you've got to ask to be seen by the emergency doctor, because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
Oh, dear.
No.
Now, all you'll hear is different sounds. The slightest sound, Joyce, from this ear. Right. You say yes. Here we go, Joyce.
Okay, and I'd just like to follow my finger, keep your head still. I'm just going to shine a light in your eye, if that's okay? Up and down.
Yes. Yes.
Well done.
What's the problem?
Do you know what the problem is?
Yes, in my throat.
It's got a sore throat
Right.
and a bad cough.
How long's it been there for?
Yeah, Michael.
I think at least a week, isn't
About
it?
a week.
Yeah, that's the way.
Let's have a look in your throat then. Give me a nice big like this.
Yeah.
Look, oh, wow, that's really good. Let's have a look here. Say for me. Beautiful. Good. Everything looks really good back there.
Yeah.
Yeah. Let's have a feel around your neck here. Good. Do you want to just pop your jacket off and let me have a listen to your chest? Right, let's have a listen to your chest then. Okay, deep breaths in and out for me. Excellent. Stay there 1 second, hang on. Right, all right. Do you mind if I check your blood pressure whilst you're here, Tony?
No, that one got quicker though.
That's got the fistlet, all right.
Hey.
Thanks for reminding me.
Can I work, Michael?
I'm glad somebody knows what we're doing today. Right, there you go. You can watch the numbers go up. Your blood pressure is 123/76, which is perfect.
Michael.
That's perfect. We're very happy with that.
Yeah.
So that's very good.
Yeah.
In terms of your sore throat and cough, I'm not worried at all. I think it's just a straightforward cold, a bit of a virus, which you're going to get better from all by yourself. Now, as part of our normal tests in looking after your kidneys...
my kidneys, my mum's kidneys.
Your ones.
Your kidneys.
And my mum.
And your mum's.
Yeah.
I was wondering if we could get a sample of your urine.
Okay.
Which just means that you need to do a sample in there and hand it into the reception on your way out. Okay? Was there anything else I could help you with today?
No, I think that's it, thanks.
All right?
Yes, Michael.
Right, okay.
Take care, Tony. All the best. Lovely to see you again.
Yes.
It's okay, Michael. Bye-bye. Bye, Tony.
Sorry to keep you waiting such a long time. Please come and take a seat.
Okay.
So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month's been more down and up, getting a bit low again, getting very depressed.
Mm-hmm.
I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and it's the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and it's just stable on my methadone and that, but because I've used drugs a lot in the past, and, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know, it's just the way I am.
Do you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything, yeah. But
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out, you know, what they understand about the situation, and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that is still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Do your mum or your son come into your thoughts as well?
Only family, really, now, yeah.
Mm-hmm.
You know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if you go and get in touch with us, you need to pick up the phone and talk to Mind. They've got a good helpline, or the Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that, yeah.
And I started you on some tablets as well. Do you take them every day?
I do, yeah.
Okay.
But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it. When do I run out of tablets?
Yeah.
When do I see the GP next?
Yeah.
So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I see you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.
Morning, hello.
How you doing?
Okay, thank you. How are you?
Not bad.
Why am I poking your belly?
Well done. Oh, well done. Right, make sure I've got the right person. Give me your name.
Leslie, Jane
Yeah, have to
Bernard.
check.
Yes. Left arm or right arm?
Now, you're the one that keeps telling me you've got fabulous veins, right? So let's have a look at this one.
Yeah, no, I've done this one yet. It's mostly that one.
Well, let's see, because this is nearest.
Okay, here we go.
Anyway, have you starved yourself? You've not eaten?
I had about 12 o'clock yesterday afternoon.
That's all right. But not this morning, because these are fasting bloods, all right? Let me try that one. How's your mum?
She's fine.
Do you live with your mum?
Yeah.
Yeah, I thought you did. So you've got lovely veins. Right, put your hand on there.
I'm a brave boy.
You are. You deserve a lollipop for that. Now, listen, these go off today.
Yes.
And the results will be back for Tuesday.
Okay.
Right. Let's just put a bit of tape on you. Go and eat something decent for breakfast. There you go, you're done. All right?
Look at that. Good old arm.
OK, take care.
Thank you very much.
You're welcome, bye.
Nice weekend.
And you too.
So the swelling itself only started yesterday, and have you had lots of discharge?
Yeah, I've been bathing with salt water every few hours.
OK, so if you want to go ahead and use that to... Yeah, that's it. Perfect. And is it painful?
Yeah, the upper eyelid is very painful.
OK. I'm just going to hold your eyelid up a little bit.
That's painful.
That's painful. Now, does it hurt when you move your eye about? I can't see very well.
I'll try again.
Can you see my finger?
I can.
Keep your head still and just follow with your eyes.
I don't think I can do that.
That's painful. Yeah, OK, you've had no insect bites or anything up there, but you have been unwell with sort of cough and cold symptoms. OK. The sinuses, there's one here called the ethmoid sinus, which is very close to the eye. And sometimes it's possible for infection to spread through. My worry would be, because I can't get the eye open very well and because I can't assess the eye movements, if there is any infection around the eye, if that tracks into the muscles that are close to the eye, we could be in trouble. I think we're going to have to get you over to St Thomas's.
When?
Today.
You're not joking.
No.
I can't do that.
Yes, you can. Why can't you? You're already off.
There is Moorfields.
No.
No, that's a bit of a way away.
No.
This is not a negotiation.
Oh my gosh.
Present this to reception when you get there. So, good luck.
Thank you very, very much.
Hopefully it will be just very straightforward and they can send you on your way and everyone will live happily ever after.
Thank you.
Excellent.
Thanks a lot. All right. Have a good one.
You too. Oh, thank you.
I haven't got any appointments that have been cancelled today. You'd have to give us a ring at 8 o'clock tomorrow morning for the same day appointment. No, you need to phone in at 8 on the date you want the appointment. OK then? Thanks, bye.
Hello. Come and have a seat. Natalie.
Yeah.
How are you?
Well, I've come back, so I'm still getting this real tightness in my chest at night. I feel like somebody's wrapped a belt around my chest and is pulling it really tightly.
On the front bit of your chest?
Yeah, sort of right here.
On that left?
Yeah. I will find that I sort of have to sort of stop to sort of take a breath in.
Is it that you feel you can't get enough air in?
Yeah, that's how it sort of feels. But then when I lie down at night, I get this sort of quite severe sort of chest pain.
When you lie down?
Yeah, it's when I'm lying down.
We doctors always think of the worst things first.
Yeah.
Your pain doesn't sound to me like anything to do with the heart. So we then think about what might be going on in the lungs. And you've got a normal chest x-ray. So, you know, I'm thinking, is there something else going on in the lungs?
Yeah.
You would have to speak to the duty doctor regarding that because it's a medical question.
You need to run tests on him because his immune system is amazing. He had exactly what we all had and he's better.
Sorry to burst your bubble, mate. It's not your amazing immune system.
If I press on any of these bones, do any of these hurt? Going down here. Am I producing the pain you get in that side of the chest?
Yes, yeah, you are. I can feel it sort of.
Coming across there?
Yeah.
But I'm not actually hurting, so
No.
coming down...
Yeah, that's...
Sorry?
It's right there.
And that is the pain you're getting going right across the chest? Yeah. OK. Let's turn around and listen around the back. Take a really big breath in and out. Does that hurt?
Yeah.
Sorry. And where it hurts is there?
It hurts like
Round here.
coming round underneath my breast.
OK, let's come and sit down. And you've had this a long time?
Quite a while now.
Wow. I think some of the problem is a condition which I'm going to give a funny name to, called Titsie's disease. Right? There's a joint between the end of the ribs and the breastbone. And for some reason, there is something becomes inflamed, that particular joint.
OK.
And Titsie's just the name of the guy who discovered it.
OK. Is there anything I can do about it?
Well, they do say take anti-inflammatory pain relievers. Sometimes physiotherapy can help a bit. So I don't think it's the end of the world. I'm sure we can probably help.
Thank you so much for being so thorough.
That stretches my diagnostic skills, but I think I've got the right diagnosis.
I wanted to do the poo sample and check there wasn't a bacteria in your stomach.
Everything feels normal when you're wiping your bum and... Yeah, OK.
You don't pass jet black sticky poo.
Yeah, maybe.
He's done it too, hasn't he?
How can I help you today?
My mum just found out recently she's got cancer and that. So I just want to get myself checked out basically to just make sure that everything's okay, really. Yeah.
Tell me what happened with your mum, what she been diagnosed with.
She went for a checkup and I just colon checked and stuff and they said that she had cancer spreading from her kidney to her lung.
Quite tough then.
I just want to get myself sorted, just checked, just to see if I'm okay, really.
Are you worried that you might have cancer then, or...?
Yeah, because her mother died from cancer as well, so I'm thinking it might be hereditary, so...
How have you been in yourself?
I've had slight murmurs, like when your heart feels like it's Mr. B or something. It's like like I've been running, but I haven't.
Do you get other symptoms?
I've been passing urine quite frequently as well.
Because of those symptoms, with peeing more frequently, I just need to ask you a few more sensitive questions. Okay, when was the last time that you had sex?
I'd say a month ago, 3 to 4 weeks.
Was it with a regular partner?
Yeah, I would say so.
Have you had sex with anyone else?
2 people besides this girl, but they're all regular.
So you're having sex with 3 different...
Yeah, basically.
Do you get any discharge from your penis at all?
Nah, I don't think I've contracted anything like that.
What we can do is listen to your heart and lungs and take a look at your stomach. So sit up for me, sit up. Deep breath in that. And out. Okay, and in. Okay, your chest and heart sound fine. I'll get you just to lie back for me and I'll take a look at your stomach. So just gently press. Yeah. So it's not painful at all.
Nah.
Okay, your stomach feels okay. You know what I'd say is examining you, to me, everything is normal to examine. Okay. So that's reassuring.
Yeah.
I mean, you're telling me that you're sleeping with 3 different girls at the moment. That puts you at higher risk of having sexually transmitted diseases. So you need to make sure you're practicing safe sex, so using condom.
Yeah, definitely.
But you are at high risk of the fact you're having 3 different partners. So I could get you to do a urine sample to test for chlamydia and gonorrhea. Have you got details for the sexual health clinic as well?
No, I haven't. So if you've got a number, I'll be very
I can give you details if you want to have a full check.
Yeah, thanks very much for that.
Right, no problem.
Come in. Hello. Come in. How are you today?
I think Bailey might have chicken pox. He's come up in the little spots, so I just wanted to check to make sure.
Has he been in contact with anybody with chicken pox?
His little cousin has it.
So when was he in contact with it? Week, 10 days ago?
Very recent.
Yeah.
Very recent.
Should we have a look? Oh, yes. We've got some spots on his back coming out. Here. Can you see? They're coming out in little bumps, in blisters first. Then they usually become a sort of yellowy pussy for a little while, and then they come scabby. So have you got any on your head? Let's have a look.
A little bump there, I can see.
Possibly, and a possibly little
Yeah,
one there,
yeah,
isn't there?
yeah.
Shall we have a look in your mouth now? Hasn't actually got anything in his mouth yet. He's got a wee bit of a temperature. 37.7. Right, the normal is 37.5 and below, so it's just a fraction above normal. I think it probably is going to be chickenpox, to be honest. He's actually infectious 6 days from when the rash comes out. Now, the spots won't have gone by the end of that 6 days, but they will be scabbed over and his temperature will be down. But, you know, he needs to be off school, I'm afraid.
Yeah, that's fine.
Is that all right?
That's fine.
It's a good thing to get it over with, you know. Well, there we are. Champion.
Thank you for your help.
Good, bye.
Bye.
God bless you, Doctor.
Take care.
Thank you very much.
Oh, thank you. Bye-bye.
Bye-bye.
What a good doctor you are.
Take care. Lovely to meet you.
Thank you very much.
Go away. Behave yourself. Take care. Bye-bye.
Thanks for your help. No problem. All the best. Take care.
All right.
Take care. God bless
You take care too. See you again. Bye-bye.